Demo of 2024 Caelestinus Spring Batch. I am Thomas, and it's great to be in a hospital. You know, this sounds funny, but it's not. It's real because we are not gonna get surgeries and blood spurting, as you know, from operating theaters, but we are here to witness our top startups in health tech that will transform the way healthcare is managed all around the world. It's my pleasure to be here live at the Institute of Clinical and Experimental Medicine in Prague, and this is the final demo of Spring 2024 Caelestinus Healthcare Incubator. So, in case you just tuned in, and you don't know what this broadcast is going to be about, I'll give you a brief explanation what demo is. Demo is a pitch opportunity for our startups where they explain and present and show what they have built in just 7 minutes. So they have 7 minutes to explain what they want to do, what they want to achieve. Quite likely you are one of our startups, one of our Caelestini, so hi, it's really starting, it's happening. I am not AI generated as yet, but you know, next year perhaps I won't even have to be here. All is AI powered, and you will see to what extent based on our pitches. So you also could be an investor, someone looking to help our startups grow worldwide, in Europe, in the US, in Asia, all around the world. So this is your moment to pick up your favorite startups. And if you like what they want to do and you want to be part of their journey, just get in touch with them, unless you're already talking already. So the agenda for today, it's going to be pretty busy. So let me show you a few slides. So if I could have the slides, please, because I want to show you the which startups go when. Right. So first of all, before we get down to the 15 startups that made it, that went through our intensive 4 months incubation, just a short recap. At the beginning, there were 65 startups that applied. We picked 23 and invited them to join, and 15 survived. So I think they deserve a big clap. Thank you. You know, it's not easy to go through all the workshop, all the mastermind sessions, all the pitches, all the demos, all the mentoring sessions. It's been intensive ride for the last 4 months, really. Today we'll be presenting special awards on top of being able to witness our startups, get to know them, get in touch. Their demos will be presenting as Caelestinus, will be giving out special awards to 4 teams. And those special awards will be a special award to the startup with most pilots that happened during incubation, the biggest business progress, then there'll be expert choice, and then there is community award. And if you are watching us, you have voted, you have cast your votes who that community award goes to. Right, before I invite first keynote speaker, I would like to thank again to those behind Caelestinus. So mostly InterSystems, we are part of the startup program to develop and support startups building solutions in healthcare globally. Then also Institute of Clinical and Experimental Medicine here in Prague. A big thank you. We are broadcasting live for InChem. Thank for CHEX. It's the biggest hackathon organizer in Europe. So influx of new talent is happening through hackathons, and it's great that Caelestinus has always a seat or place for hackers, new ideas, new teams that may not have been incorporated yet. Thanks for the Czech Technical University in Prague, and thanks to all those that supported us during the past year and still continue. There is a lot of supporters from all sorts of fields, so a big thank you to you all. So what's new and different from last year is the Special Achievement Awards. So these will be announced after all the pitches, after all the demos. So waiting is half the pleasure, and you'll be getting quite a load of pleasure. The way it's gonna work is that each team has 13 minutes maximum in total. So there'll be 7 minutes for your pitch, and then we will allow for questions from the audience. You can ask questions via Slido. So if you check the final demo day hashtag, you can insert it in slido.com. You can use the QR code. So this is the way you can ask questions from anywhere. And also those that are present here at ICAM will be able to ask questions using our colored microphones. So it's anyone can ask questions. We are expecting most questions from investors, but it could be from mentors, from fellow teams, fellow Caelestini. Anyone can ask anything. Right, so this is our agenda, pretty busy. We have 2 coffee breaks, and there are 15 teams pitching all together, so it will be 5-5-5. So there'll be 3 sessions, and you can see your name of your startup, of those that you are interested in, on this on the screen. So we'll be pretty strict regarding time, so that you can plan well when to appear, when to disappear, when to ask questions, etc. All this session, all the pitches will be recorded. So if you miss something, you can rewatch. We will share it with our Caelestini and investors and supporters. So don't worry, we'll provide you with a professional recording. Right, and of course for those that made it to Prague and still can make it, there is an after party at the swim club in Štěpánska, at the very center of Prague. So you are all invited, and it's going to be, hopefully even better than last year. And if you remember swim, the party that took place last year, you are in better shape than me. I don't remember much. Fine, and I'd like now to invite Dean to say hello from the East Coast, I believe. So Dean, it's nice to see you again. Of course, I saw you a while ago at the Global Summit, but that's this physical presence, that's, yeah, I mean, I like you even through pixels. So Dean, please.
Me as well.
We have the 3rd year final demo. Go ahead.
Can you believe it? Yes. Thank you, Tomas. Thank you and the entire Caelestinus team and all of the partners of Caelestinus. Caelestinus is absolutely a critical part of the InterSystems startup program, and we thank you. I can't believe it's the 3rd year. To all of the startups today, we want to thank you for all of your hard work over the last 4 months. It has been absolutely inspirational. We have all seen it over the many sessions virtually, and I had the great pleasure of meeting some of you at our InterSystems Global Summit conference just 2 weeks ago. I look forward to meeting many more of you in the coming months as well. One of the things that has struck me over these months and meeting you in person is the diversity of the startups, and that diversity can be measured in every dimension that you can imagine diversity. diversity of the founders, diversity of the locations of the startups around the world, the diversity of the use cases that you're working on, and many, many more. It's been amazing to witness. We are very proud at InterSystems to have been a part of your journey thus far, and we hope to continue to be part of your journey as you move forward. I want to tell all of you to keep going past this demo day, continue the work that you're doing. It is absolutely vital. You are improving people's lives, so please continue. We are very excited to see your final demos today, and we look forward to engaging after that as well. Good luck, and thank you.
Thank you, Dean. Waving back across the sea. And now I think it's time for our pitches to start. So I think the first one, let's see if the agenda, can check with the agenda, but I think it should be, yeah. Is it Unifi.ai?
Yes.
Excellent. So, hello, it's great to have you here. I am sure you remember the rules of the game. You have 7 minutes for your pitch so that we can have questions from the audience. So whenever you're ready, go ahead. I have a timer for you here. I hope you are checking your time. If there is just 1 minute left, I might say 1 minute left or whatever. Okay, so please go ahead.
Do I need just one question? Do I need to share the screen?
Okay, Pramod, no problem. Just we can now see your screen with nice green and background Unifi.ai.
Yeah. Thank you. Good morning, good afternoon, depending on which time zone you are. Thanks a lot for being me here. I'm Pramod Mishra, co-founder of Unifi.ai. If you have ever worked in any healthcare provider organization or associated organization, you can imagine that every week, almost 8 to 10 hours or probably more, you spend time just copying data from one document to another, or probably from one application to another. And that's even more difficult in healthcare because close to 80-90% of the records are unstructured. And post-Gen AI world, it's growing 3 times versus the structured data. Now, what's the problem in that? The problem is that the precious employees' time, especially nurses and physicians, are wasted on filling these forms or completing, different documents. If you put a number against this, the time spent on that, it's close to $2,000 per employee, which accumulates to a big number if you calculate for the overall organization. Now, how companies currently addressing this problem? So either they depend on employees, but it's both unpredictable as well as expensive. Some companies try to get outsourced vendors, but again, it's too expensive as well as it doesn't get all the features what employees want. So that's a limitation in that. Similarly, there are some other startups who are also trying to build something similar, but none of them are focused on healthcare. So they provide a generic solution, and that mostly on extraction of information, not too much on using cognition or intelligence. Now, what we are doing, we are building Zapier for healthcare documents. Now, what it does basically 3 key functionalities. One is extraction any information from any kind of construction document. Second is contextualization, right? Because information is irrelevant until you know what is the context. The single word of policy might be very different for HR organization versus a policy versus a insurance organization versus any other individual. So understanding the context and then interpreting those documents is very crucial. And the third part is cognition. Even when you get the extraction and context, you also want to apply some rules and then use that information to probably to fill another application, to fill another document, etc. We got all these three functionalities in our product. We have built this B2B SaaS platform where you can just connect any input unstructured document and say that, okay, this is the output I need. We do everything in between. Right now, we are live both on website as well as on API.
Okay, right. We lost Pramod, so let's give Pramod a while to get back online. Yeah, you know, this happens. It's part of the fun. Of course, we can do it in person, but online has this poetical magic of broadcast suddenly stopping, putting people in the real world scenarios where the unexpected happens. So, of course, it's pretty unfortunate, but it's part of the startup improvisation portfolio to be able to present even though when you are not visible. You know, how to do this? It sounds nonsensical. You cannot present if you are not there. But of course, you can send around stuff, send around messages. You know, where are you? You send your pitch decks. You use social media, maybe. Because our startups, they have investor lists. So I'm sure already Pramod had reached out to his investors. Yeah?
I'm sorry, I just got...
Excellent. So go ahead. You can continue. Yeah. That's fine. We just were talking about you. I said a few jokes, and yeah, it's fine.
Yeah, unfortunately, I have to, because of some urgency, I have to travel to a remote location, and I have these issues in connectivity.
Okay, so go ahead.
Thank you. So the three key functionalities in our product. One is we provide customization of data selection in a response. So in a way, we provide vector database as a service. Second is our models are pre-trained on industry-specific use cases. So for healthcare, our models are customized. The third is we encrypt all the PII and SPI in any document, right? So there is no risk on any personal or special information. And also, we do not store any data at our end. Now, what are the key three products we have launched? So first is Unifi.ai Fire, which basically extracts any fire computable information and codes from any document. The second is Unifi AMR, basically is the most popular and which is used by two healthcare organizations, is basically creating clinical summaries and embedded PDF from any EMR. And we have integrated with, so far, three big platform provider in AMR. And the third one is autofill. What it does is basically for many times employees as well as patients have to fill a form to just copy data from one application to this form. We automate that part. So in a way, we become like a simple Zapier. You just say that input document and output, and everything else in between is done by us. We have built all these three products using Iris Vector Search, and we have got great feedback from both our partners as well as users in terms of its, performance and compatibility. Our traction, so far we have got 25K MRR from a hospital based in Atlanta and a medical device company. Our cumulative revenue is 300K, and we are targeting to achieve 1 million ARR by next year. Currently, we have almost close to 20 ongoing pilots and discussions going on. Our teams, me and Neha, we have a background in data science and data governance. We've also got great awards in terms of best B2B AI product from Stevie and also Georgia's top 40 most innovative companies. In terms of we have got invested by 2 angel investors, and also we got incubated from Createx, which is Georgia Tech Incubator. We have recently, last month, there's a study published on AI governance, and the reason we participated in that because we strongly believe that whatever work we are doing in terms of building AI models, there needs to be a strong AI governance framework. And we are part of this ecosystem, and that's where we are, whatever tools we are building, we are making sure that these are all safe, secure, as well as compliant from all provided frameworks. Thank you.
Thank you, Pramod. That was great. Even timing was spot on. Now we still have about 4 minutes of question time. So anyone, either if you are watching online, you can use Slido. So far we have a question. So you can use Slido, or here at ICAM, you can take the mic and appear on stage. So what other industries might be relevant for you, Pramod? It's the first questions from Slido.
Thank you. Great question. Yeah, so in fact, we have got also equally interest from, let's say, financial and real estate. So any industry where there is a lot of documentation or regulatory compliance, they're typically our end users. So we are working with one real estate developers where we extract information from long signed contracts and then put this information in another application. Same way from financial perspective, we get this information from even annual reports and similar regulatory documents to make it input to another application. So typically, I would say financial, regulatory, real estate, and legal teams in other companies. Thank you.
Great. Any more questions? There is none on Slido. Perhaps someone here at ICAM. Oh, we have one more. What are the inputs for your product? Is it scanned PDFs?
Yes. So it's not also limited to scanned PDFs. So even if you have, sometimes when you use DocuSign or any, I would say, application for signing a document, it got converted to an image. So we also work with images. We also work with scanned PDF or normal PDF or any notes document. So anything where you have unstructured data, we can input that document in our application and make it computable as in downstream. So.
Thank you, Pramod. Still time for one final question. Yeah, okay, we have Andrei here at ICAM. Andrei is now running down, grabbing mic, doing a somersault and joining me on the stage. So Andrei, you come please to join me, and
hi, Pramod.
Here is a special mark for the questions.
Cool. Hi, Pramod. I would like to ask which markets you are targeting. So primarily, as I get it, it is US, but is your plan to expand to maybe other countries? Is your solution limited to per language? Would it need additional development? And basically what your plans are?
Great question. Thank you. So in terms of primary market, yes, it's a US market. But right now we are doing 2 trials. One pilot with a pharma company based in Europe. And secondly, with one financial company based in Middle East. So from a commercial operation, yes, right now it's only the US market. But yes, we are doing pilots right now and exploring these possibilities in other markets as well. On the second question on other languages, so yes, our tool can also do the translation from other languages, but it has its limitation in terms of the accuracy slightly goes down because of availability of the parallel term in those languages. So our training time typically increases to from a normal of 2 to 3 weeks to probably 8 to 10 weeks when we work with any language other than English. So it takes probably a longer time for us to pre-train our models in case of any other language. But if it's English language, we are much more faster to get it deployed.
Okay, thank you.
Okay, thanks. Thank you, Andrei, for your question. Thank you, Pramod, for great first pitch with a twist of technical glitch. But that will never.
I'm extremely sorry.
That will never change.
Suddenly,
come on, it's a bit of adrenaline to start off with. So thank you again, Pramod. Good luck, and we'll be moving along. And the next one to present next Caelestinus should be Praxium.ai. So whom do we have to demo?
That would be Nelson. You're looking at Nicholas currently for some reason.
Yeah, that's what I thought. I mean, Nelson. Oh, here we go, guys.
There we go.
Hello, Nelson. So we can see you, hear you, and then perhaps check your screen sharing.
Yeah,
powers.
Let's give it a whirl. Just give me a shout, Tomasz.
That's fine. I mean, we are humans. It's not AI managed yet, so I'm fine. I'm happy to wait. We can see your screen, Praxium AI Copilot for Radiologists. It's with some cool visuals.
Thank you. Just give me a heads up when we're ready to kick off.
Yeah, whenever you're ready, just go ahead, start presenting. You have 7 minutes for your pitch and then 6 minutes question time, plus minus. Go ahead.
Fantastic. Thanks everyone for joining us today. So we are Praxium, and we're building an AI co-pilot for radiologists in low and middle income countries. So first things first, let's get to know the team. It's myself and Nicholas. I'm the CEO. We're both second-time founders. I've formerly raised $1 million from European and US investors. I've got significant experience of scaling up both VC-backed and bootstrap startups. Nicholas has amazing experience both in AI, because he spent 4 years building deep learning models for Replica AI, and also radiology. He is the co-founder of Mammologicum, where he created a breast education platform that served several thousand radiologists in the exact areas that we're targeting as well. So whereas Nicholas's connection to this is very much professional, I'd say mine is more personal. So in March 2020, my mother-in-law, Michelle, was diagnosed with triple-negative breast cancer. My wife and I moved back from Spain to live with her. My wife became her full-time carer. And essentially, the only reason that she's with us today is because in the UK, we have a free breast cancer screening service. It was found literally in her final screening exam before she aged out of that service. Unfortunately, this is a luxury that many radiologists in low and middle, many patients, I should say, in low and middle income countries do not have. Unfortunately, the first time that they understand that they have cancer is when they're referred by a doctor to a radiologist with symptoms. This, for a lot of people, unfortunately, is too late, and it leads to 670,000 deaths each and every year. Now, we can see a market divide in where the AI solutions are currently looking at. So we have 1.2 billion people in high-income countries, which is actually where most of the competition is. Well, if you look at it, 6.8 billion people live in low and middle-income countries. They're currently underserved. And one of the core reasons is that the radiologists in these countries are generalists, not specialists. In the UK, if your mammogram is read, it will be read by 2 breast specialists who read 5,000 mammograms a year just to become eligible to be part of that program. You compare that to generalists that are working across multiple imaging modalities. They're looking at different anatomical regions. They just don't get experienced enough to feel comfortable making some of these diagnoses. And we see some of these issues crop up time and time again with the competition. They create products that are just far too high to gain adoption. They assume expertise that generalists don't have, and they also work across a very, very narrow scope of tasks. And that's why we're building Praxium. So as I said, we're an AI co-pilot for radiologists in these low and middle income countries. And it's our aim to make it economically and technologically feasible every country in the world to be able to offer breast cancer screening services. So we can see how Praxium operates in 3 ways. Number 1, it increases the accuracy of radiologists. They're able to detect cancers that they would have missed previously. It then increases their understanding. They're able to actually interact with the model and ask questions such as, You've identified this as a fibroadenoma, but it looks like a carcinoma to me. Please explain why. And thirdly, it increases their productivity by helping them with reporting and speeding up that process. In terms of our business model, very, very simple to understand. The radiologists pay per single use patient case, and we price it less than a local radiologist. So far, we've won 275,000 in a very, very competitive grant process with Innovate UK to further develop our multimodal AI co-pilot, and we've secured 5,000 from InterSystems, who very kindly support the Caelestinus program. We've also landed our first paying client, a radiology clinic in Georgia. Now we're raising a pre-seed of 500,000, which will allow us to open up 120,000 in pilots in terms of ARR. We don't have it on this slide because we weren't allowed to reveal the information today, but I'm actually doing this from the Praetor Ventures office. We have just kicked off the pre-seed program, which should allow us to raise 150 to 200K from them. Nicholas doesn't know this either because I've literally just got off a phone call with them, but Baltic Ventures have also just added their first 30K and are also helping us raise additional funds. Nicholas, sorry you had to find out this way, but this is where we are. It's all good news. So at Praxium, as I said, we're looking to make it technologically and economically feasible for every single country in the world to be able to offer breast cancer screening to their patients. I'd love to hear your questions, and I hope you can follow us along for the journey.
Well, thank you, Nelson, for your great pitch. Exactly on time. I'm sure you must have practiced this at least this morning in the bathroom.
Yeah, I've been muttering away to myself, but I'm quite content looking like I'm crazy.
It's very good. So let's have questions then. You can use our Slido, #FinalDemoDay, or if you happen to be here physically at eChem in Prague, fire at will. Honza looks like he's going to ask something. So again, we have a physical human being about to jump onto our stage. So Jan from Tensor Ventures. So you're having a VC question. So please, if you could use this little mark. Thank you.
Hi, Nelson. So I would like to ask about the feedback from your first customer. How's that going? And also, how are you guys thinking about the go-to-market for the product, if anything changed? I think we talked already, yeah.
Sure. Well, I can give you the feedback based on the week and a half that they've so far been using the product. so still early days, but looking very, very promising. One of the key things that we do differently to our competitors is not only using AI as a second opinion, but also keeping a human radiologist in the loop. So if you can imagine an isolated radiologist, in this case, Georgia, they're largely self-trained and self-educated in this area. They actually don't have anybody else to turn to who can corroborate their findings or can pick up on things or even just improve their own skill sets. So one of the things that they're most excited about is that they can use us for their diagnostic mammograms, those edge cases that they're not so sure of, to be able to get a second opinion really, really quickly. And I think that's been kind of what's allowed us to get those sales and those early interests so quickly.
Okay, thank you.
Okay, thanks. Thanks also, Jan, for his question. I'm checking Slido. So far, no other question. Maybe, yeah, we do have one. How do you make sure the diagnosis explanation feature doesn't hallucinate replies,
sure,
as LLMs tend to do?
So maybe Nicholas can talk a little bit about retrieval augmented generation.
Yeah, of course. It is a big issue, especially in medical space, because the results that you need to return, of course, they should be reliable enough. Right now, we are experimenting with RAGs, retrieval augmented generation. So we have a bunch of predefined articles that they are added to our database, and we're using InterSystems vector search to score different paragraphs within those articles. I cannot say that it's working 100% reliably. It's very early days of experiments, but that's the way forward.
Right, thanks for making this clear. We still have time for one.
Maybe a question from Matthew, if nobody minds.
Yeah, thanks. I had my hand up. I guess I'm maybe asking the question in the wrong place. So nice presentation. Thank you for all that great information. First part of my question is about the regulatory requirements. You've got a lot of countries listed in your go-to-market. So how are you going to address the unique regulatory requirements in most of those countries? And then who is going to put the product into the hands of the radiologists?
Yeah, two fantastic questions. And we love to see those questions specifically because I think a lot of people get hung up when they hear the multimodal AI part, when actually the more important part is, okay, assuming you can create this technology, what are you going to do with it? So for us on the regulatory side, part of what we're calling our market attractiveness exercise, we're working currently with 3 organizations located here in the UK that are helping us understand the regulatory approval process in different regions, but also things like the clinical pathways. So we're working with 2 groups from the West Midlands Health Tech Innovation Accelerator, also from University Hospitals Birmingham, and we also have an independent regulatory consultant who's helping us with this. So the key things to understand for us are, where do one overarching kind of regulatory body help us get into multiple countries, in the case of the EU, for example, and CE marking, MDR, looking at other countries as well, which countries follow kind of FDA, and then which countries have their own independent regulatory bodies. I'm thinking in particular things like countries like India and the CDSCO and things like that. So I guess if I was to summarize, I would say we don't have the answers right now, but part of this pre-seed, our kind of milestones are to be able to better understand those and how we can navigate them and in which order is the priority for us is going to be absolutely key. In terms of how do we get this into people's hands, what we're trying to do is kind of do a manual brute force approach with the first 50 to 100 clinics. And we're able to do this because Nicholas has an extensive existing network of radiologists, specifically in low and middle income countries. However, that only gets us so far. And we're operating in fragmented markets. So very much key to not only our growth, but potential exits and acquisitions further down the road is partnerships. It's how can we tap into those existing networks, fantastic organizations like InterSystems, but also larger organizations on the hardware side. So GE, Siemens, Hologic, Philips. So really it's going to be what takes us from, when we're able to secure 1 to 2 million revenue to what ultimately will make us 100, 200 or more million in revenue is going to be how well we can execute on establishing those partnerships. But key to that is coming to the table with something. So if we have 1 or 2 clinics, that doesn't get anybody's heads turning or juices flowing. So it's how far can we push it? How quickly can we grow that we can actually bring some serious negotiating power to the table with these partnerships.
Okay, thank you, Matthew, for your question. I am just checking on this. Have you reached out to CareBot, our mentors in Caelestinus? They also have and are still building a startup for radiologists, and they might help you with the European countries. So I'm sure you are in touch, Nelson. Yeah, perfect, excellent. So thanks for your pitch, Praxium. I think that the breast cancer is the most common cancer found in women is a big issue and is growing to be. So great stuff there. We'll be now moving on to POSOS, and hopefully we have Emmanuel online. So let me just...
Absolutely.
Yeah.
Hi.
Emmanuel, bonjour, comment ça va? Ça va très bien.
Yeah.
It's nice to see you again.
Yes, and I was impressed by your French last time we discussed. Congrats for that.
Yeah, but now it's time for us to be impressed by your pitch and demo, and let us know what you have been working on over the last 4 months, plus, you know, those years that you have spent building POSOS. Okay, so POSOS and Emmanuel.
Thank you very much. So it's not a pitch for investors. It's more about sharing what we've done as part of this accelerator program, and we are very, very proud because we achieved the objective we had of building a first prototype embedded into TrackCare InterSystems EHR. So I'm happy to share with you what we've done so far, and also let you know the announcement we did last week. I will let that as a teaser for the moment. So basic, information about POSOS. So we have been founded 6 years ago by Benjamin and myself. I'm a pharmacist. He's an engineer. We are now a team of 45 pharmacists and engineers. We have deployed POSOS already in more than 30 hospitals, working with 19 EHR publishers in Europe. And we have 90,000 practitioners, both some are physicians, some are pharmacists, some are nurses, dentists, using POSOS to accelerate and secure the prescription process. And that's where we wanted to go even further with this accelerator program. As you know, prescription is not only a complex process because you have to adapt to the treatment based on your patient profile. You have to make sure that each drug is compatible with the drug, the other drug that the patient is taking. You have to make sure that the drug is compatible with the other conditions of your patients. You have to make sure that each drug is compatible with the biological function, like renal function or the liver function of your patients. And that's not all. You also have to adapt the dosage of each drug to your patient's age, patient weight, patient renal function as well. So it's extremely complex and so time consuming. But not only the fact of choosing the right drug is complex and time consuming, but also just writing your prescription within your EHR could take more than 10 minutes because basically you need to type one by one each drug name, each organic form, each strength you prescribe, and also the dosage in the morning, for lunch, for dinner, and any additional information about the dosage. So you can imagine how painful it is for physicians, and we wanted not only to streamline the process but also secure it. So basically, also to give you some numbers about that, there is sometimes up to 30% of error rate in this process of writing a prescription in EHR following some publication that have been done last year. In some EHRs, you need 62 clicks to prescribe only one drug, and in the best EHR, it's 18 clicks, and up to 7% of these errors are responsible for hospital admission of patients. So what we've built as a prototype is the possibility to dictate your prescription so as to avoid this long process of writing one by one each drug, each posology, etc. And we did that with using Dragon, which is a solution, a voice-to-text solution provided by Microsoft on the market. And based on the patient profile that we retrieve from the EHR, we can correct the prescription, providing physician with suggestions to adapt the drug if it's not compatible or adapt the dosage. So not only you can like immediately get your prescription written in your software, but also make sure in one click that you don't make a mistake. And anytime there is a risk, POSOS tells you what to do. The great thing about it is also that it has been, so we already have the connectors with all the 15, I said 18, and it's even 18 now, EHR provider, because we developed this and like double connectors with those software publishers for an existing feature that we distribute with them. So it's very, very easy to integrate this new feature of voice dictation and correction, as we don't need to build any new connectors. And this is possible now because we are also our own the owner of our own multilingual, multi-country medical database. So we have the possibility to scale these features in any country, any language, and using the Microsoft Dragon features that is developed in every country. It's even easier, and we have a couple of like NLP function and automatic prescription check that are already available in your existing solution suites. So maybe to show you, if I can share my screen still, I think it works. I hope so. No, I have to switch. I will show you exactly how it works in TrackCare. Do you have like one more minute?
Yeah.
Great. Super. So here is a video, a screencast we did within TrackCare. So TrackCare is the inter-system EHR. So within TrackCare, you had all your patient information. We retrieve this information, and very quickly you open the prototype we developed. All the patient profile is already written, and you can dictate your prescription using your mobile phone or using the microphone of your computer. And automatically, you see on the left side the prescription dictate that is structured. On the right side, the prescription and alerts if there are risks. And also in one click, I think you can see here on the video, but you can correct it. And automatically, you got all the prescription and medication that have been populated into the EHR by the solution. So that's very, very easy to use. We tested it in French, then we tested it in English also, and physicians are very happy with it. And already 5 EHR providers have requested us to develop the solution or the features in their portfolio. Last thing, just to go back to my slides.
It's like 30 seconds, Emmanuel.
Yeah, so I will end it up with the great news of last week. We announced an official collaboration with Microsoft to market together the solution everywhere in the world. So Microsoft sales team and marketing teams will add these features in their catalogs to enable POSOS voice dictation in every EHR in the world. So it's a great news for us, and that's possible thanks to what we did with the Caelestinus Accelerator program. So I would like to finish by a big thank you to the Intersystem and Caelestinus teams, because that's also thanks to your help.
Well, thank you, Emmanuel. Thanks for the nice words. There should be more thank you. You know, it always feels nice when actually you get noticed. So it's a great news about Microsoft. I didn't know. So congratulations to you as well. And now it's question time. So you can use Slido. You can ask questions here at eCam, or you can, if you are on the call, you can use Zoom. Just directly shout your question at Emmanuel. So I have first one on Slido. Do you plan to get an FDA approval or CE mark?
So the CE mark, we are already in the process of getting the CE Mark 2B. We already have the CE Mark 1. So we are currently in this audit process, and then we have a last step with some corrections to bring to our file. But we should be ready by the end of the year for the CE Mark 2B. And currently in the US market, we are not considered as a medical device. We just need to adapt our quality management system to the local. It's just to access the US market now.
Okay, thanks. More questions? Also, anyone on the call from InterSystems, mentors, startups can raise questions. We still have 3 minutes question time.
So I see. Oh, yeah. Okay, that's good.
Okay, maybe a question on my side regarding your competitors and what's unique, what's your magic that beats them all. So maybe could you tell us about, where's your silver bullet?
Yeah, that's a silver bullet. I like it. There are two things that are like unique for POSOS. First one, we developed dedicated models to structure a prescription from any picture, voice, or raw text into a FHIR object that can be imported by any EHR. So it's it's a 2.5 year R&D project. We are the only one to have great performance on that. There are many actors doing something similar, but no one can very structure a dosage with this level of fiability. And we even have a dedicated NLP model to check if the structuration is right or not, so that it's very safe. And the second one, we are the only one to have a drug database that is not like a country-based database, but an universal database with the drugs from every countries, every language as well. So that this feature is scalable, and I think it's very important because building this kind of prototype for one country won't be a great added value for international software provider, neither for Microsoft, for instance. But this capacity we have to scale at a worldwide level is something that really make a difference, and that's only because we have this unique drug database that enable us to adapt the solution to every country. So that's the silver bullet or bullets we have.
Thank you, Emmanuel. One last question: who pays for this? How do you make money?
Basically, it's an economic model that is close to the one that Microsoft have with Dragon. So they sell subscriptions to physicians or pharmacists in hospital or in private clinics. That's the same way we work currently with our system that can scan a paper script in hospitals. As you save like 10 minutes by patients, it's a lot of money or productivity we enable for the caregivers. So hospitals subscribe in a number of license for their caregivers, and it's a SaaS model. So we already signed more than 30 hospitals with this model, and we are very confident we can enlarge that with the help of Microsoft.
Thank you again. That was our last question. Thanks for a great presentation of your progress and also good news for your future. It's been a real pleasure having you in Caelestinus, and I'm looking forward to catching up on the wonderful news and your progress in person, maybe in Paris, in Prague, in DC. We are global, so let's meet again soon. So thank you, Emmanuel. Thanks, POSOS, for the presentation. And now we are going to have somebody joining us on stage here at ICAM, and it's none other than Neatsy AI, and we should have Artem, who came to Prague to do a live pitch in person. Hi, Artem. So are you happy? Are you excited to be here? You're fine.
Does it work? Yes.
Yeah.
Yeah. Prague is a wonderful city. Every time I have the opportunity to get here with some plausible cause, I just take the opportunity.
So you really had opportunity to look around. I thought you had a meeting, one meeting, next meeting, investors, and you usually don't have time to take in the city, but you took some Uber rides.
Well, I'm actually here for just one day. I arrived yesterday, and I have a train this night. So right after the party,
yeah.
You have to take the personal responsibility to just tell me, go to train station.
Yeah, I'm telling you now, and you remember that just in time. So okay. Don't forget to take the train. And now let's have your pitch. So you have the timer here.
Yes,
try to make it around
clicker.
Clicker. I will provide you with clicker.
Okay, let's try. Does it work? Okay. Yes, it's working. Hi everyone. My name is Artem, and I want to help 1 billion people worldwide to get rid of chronic musculoskeletal pain. I'm talking about foot pain, knee pain, spine pain, all sorts of pain in muscles and joints. Because for me, it started 10 years ago when I moved to London, started my university. I started to walk a lot and started to have some pain in my foot and knees. I tried to treat it the conventional way, did all the tests, physical therapy, but it was just long and expensive process. And more than the time and expense, it started to take a mental toll on me. I just accepted that some activities are not part of my life anymore. I cannot run, and even like a 15-minute walk is hard for me. And it's not just me who lives like that. Musculoskeletal care is the #1 healthcare cost in the United States and in Europe. It's just so many people, half of all adults are affected. And that's why it makes it so big. And since it's a lot of people, the logical way how we can optimize this cost is going online, right? Doing telehealth. And that's what the market is trying to do. Money flowing into the industry. For example, Hinge Health, they raised $1 billion. And what they do essentially Zoom calls. Okay? But somebody still have to pay for doctor's time. And most importantly, what do you think the doctors see on the other side of the Zoom call? It's just your face and shoulders, and that's it. It's very hard for a physician to assess posture. It's very hard to assess gait. It's very hard to assess foot deformities. It's even hard to understand where your pain is located exactly, what kind of movement caused this pain. And I think there is a better way. So we are a team of Harvard Medical School researchers. We have great AI engineers, orthopedic surgeons from Mass General Hospital, and I'm a repeat founder, previously CEO at Prisma, an app with 200 million users. We developed a way how the doctors could see the patient without actually seeing them in person. So we created a patient app that collects the data. You take your phone, and it's just phone camera and nothing else. You take a couple of pictures of your foot or your spine, or you record a video how you walk. All of this data comes into the doctor's dashboard, so doctors can review it. Our decision support system provides a list of possible health issues, a clinical note, and a possible treatment plan. Physician can edit it, and then patient follows physical therapy through the app, or can order custom orthotics or better fitting shoes through the app. All of this process enables doctors to see the patient remotely. And we launched a little bit more than a year ago. We already have 2,000 patients. People love our app because it's a fast, affordable way to get first line of care. And doctors love it because we enable to bill health insurers with remote patient monitoring codes and economize doctors' time. We went from 0 to $500,000 revenues. our business model is sell to healthcare providers because we enable them to build health insurance with remote patient monitoring codes, improve patient outcomes, reduce the time of doctor spent per patient, and thus we deliver 5 to 10 times ROI with our $30 per month per patient subscription. It's very hard for competitors to catch us because we have 2 patents, we passed clinical trials, and we own all our AI models and data. Since I started to take care of my chronic pain, I was able to return to my active lifestyle. Because at Neatsy, we understood that all the pain is personal. You should never suffer alone. Thank you.
Thank you, Artem, for your great presentation.
Thank you.
I get the feeling that I really do need your app. As I age, they still tell you age like wine or cheese, whatever, but in real life, you just don't move as fast, so you'll show me a demo.
I'll probably sit at the desk all day.
Yeah. But anyway, we have a question. Could you elaborate on the patents? Thank you.
Yep.
So what kind of patents?
So we have 2 patents right now. One is granted, another one is pending. The first one that is granted is we basically patented the way how we do 3D models using phone camera and nothing else. So it's an accurate 3D model for foot, and we also developed a similar spine algorithm. So for foot, it's accurate enough to do custom orthotics, and this way is basically patented. You can see different foot deformities, and you can make custom orthotics through these 3D models done by the phone. And the second patent covers the way how we can basically diagnose different deformities, spine deformities, foot deformities, and it's about to get granted.
Right. Another question here. From the audience, yes, we have Honza. If you could grab your, I thought it was blue. Was it blue? Is that your mic? So Jan will join us here.
Yeah, okay.
Yes, yeah, come on in the frame.
Thank you. Okay, so I was just curious, I know we haven't talked about this, but about the clinical trials that you guys went through and the clinical endpoints that you achieved. I would just be interested in the design of the trials and what was the
Yes.
evaluation.
So what we did in clinical trials, we were trying to assess if our decision support system is accurate enough. So that was the primary target of the trials. So we specifically picked foot problems, so different foot deformities like fat foot, cavus foot, bunions, hallux valgus, and others. Most frequent deformities that people have and which are very closely associated with foot and knee pain. And so our decision support system basically helps doctors to see these deformities. So we were testing how accurate it is. So we got really great results for some of the deformities. We got about 0.92 accuracy versus the X-rays. And I remind you, this is just the phone camera, nothing else. So it's not an X-ray machine. So it's at home testing. And so yeah, that was the primary design experiment. So we were comparing a phone camera assessment versus visual assessment done by the real physicians, and versus the X-ray assessment done by the radiologist.
Okay, thank you.
Okay, thanks for your question, Jan. I'm also curious, which market are you aiming for? Which is the user payer, who are you trying to onboard and get excited about your product?
Yes, so that's a great question because when you do any kind of healthcare business, everyone have to be happy. Patients, healthcare providers and doctors, health insurance. So the product have to address all the key stakeholders. So as I said, for patients, we want to do a fast, affordable way to get the first line of care, but the main money source for us are healthcare providers. And why it matters for healthcare providers is that it helps them to streamline the operation, improve throughput, and most importantly, win new patients or new health insurance contracts, new payers. And that's a great tool for care providers to expand their business.
So you are
targeting
trying
healthcare providers.
Get on board everyone, all the actors in this healthcare triangle. Okay, I was also wondering, it could help me when I saw those shoes, the sneakers. It could help me as a individual to make choices regarding which sneakers to buy, given my gait or particular difficulties in moving. Is that something you also
exactly? That's part of the golden standard in physical therapy or podiatry treatment. When people have chronic foot and knee pain or hip pain, one of the how the patients are usually treated are physical therapy and just better fitting shoes sometimes. So podiatrists are often have to recommend some shoe styles that would be better for particular foot deformity or for particular chronic pain. So choosing the right shoe is also part of the healing process.
Well, we have one more question. What data do you collect on patients to help make clinical decisions?
So we collect foot scans, spine scans, gait videos and analysis done with the gait. We also collect visual data, visual pain mapping. So for patients, it's hard to express where they have pain exactly. They tell, hey, I have pain in the knee or I have pain in the foot. And when we speak about remote setting, it's very easy for patients to just tap on the regions of their body inside the app and say, hey, I have pain here. It's like you're like in the doctor's office and you say, hey, I have pain exactly like here when I do this, for example. And that is also valuable information for physicians to assess the patients and correct the treatment. So all in all, computer vision plus visual pain mapping.
Right. So do you also see other possibilities with your technology? For example, custom shoemaking?
Again, that's a great thing because we are right now in the custom insoles making market because podiatrists use custom insoles to treat foot pain. And that's basically it's a doctor tool to do custom orthotics online. Yes, we could be one step further for shoes as well. But what is the other exciting capability for musculoskeletal care and podiatry? In particular, we can use our technology to treat people with diabetic foot problem, which is, as you probably know, it's people like don't feel their foot really well, and sometimes they have like infections and other problems. And our technology is a great way to monitor these patients and also make custom insoles that are specific for diabetes.
Right. Oh, we still have time for one last question. Anyone here at ICHEM or online? Otherwise, it's going to be me again. My question is maybe how can the audience, which is a mix of professionals, investors, startups, how can they help you? What you are looking for right now at this moment? What is
great question. Well, first of all, you can try our app. I can give you a special link to get a free subscription to try it out as a patient. And secondly, our main goal is to expand the business right now. So over this year since February and during the Caelestinus program, we signed 4 healthcare providers. And right now, we are finding a way how we can expand the number of signed up hospitals as quickly as possible. So that's it, pretty much.
So that's it, Artem. Thank you very much.
Thank you
for your pitch. I'll take the clicker. And it's been a pleasure to have you guys here on stage. Thank you. Right. We have one last pitch ahead of us before a 15 minutes break. And I can see we already have Ready, Set, Recover. Is that correct? Ready, Set, Recover. We should have Heather and yes, of course. And the 13 minutes are now yours to exploit or use in any way you see fit. However, we are looking forward to your presentation. Ready, set, recover.
Thank you so much, Thomas. That's tempting to start singing, but I won't use my time that way.
We can hear you, we can see your screen, you are all ready to go.
Wonderful. Thank you so much. I'm Heather Campbell. I'm the CEO of Ready, Set, Recover. Thomas actually started the day by saying that the people who were there live at the event are all in a hospital but aren't getting bloody. He was, of course, joking, but if you've ever had surgery or someone you love has had surgery, you know it's not a joke. Surgery is very, very stressful. Things can feel out of your control, like everything's in the doctor's hands and nothing is in your hands. It's our mission to change that. There are 310 million inpatient surgeries per year worldwide, and that number is only growing. In almost every one of those surgeries, patients are stressed out. Stress and lack of engagement create complications and higher costs for everyone. And we all know that medical teams just don't have the time to handhold patients to work through it. It's a huge problem. Ready, Set, Recover is the solution. Think of us as an online coach. We help people during the time leading up to surgery and the time directly after. Without us, the silence is filled with inactivity and stress. But with us, there's an easy-to-use prehab and post-recovery framework that dramatically improves outcomes. We've taken the evidence-based gold standards of stress reduction and pulled them together into an easy-to-do, self-guided online platform that doesn't require training or direct involvement of medical staff. No matter what kind of surgery the patient is having, we complement the medical care. By focusing on the human side of surgery, it's both holistic and logistics. We're creating more engaged, less stressed, and more compliant patients. And that transforms recovery. And these transformations benefit everyone. It's not just the patients we're helping, but it's also the doctors, the hospitals, and insurance. It's a big problem, as I've already said, so it's a very large opportunity. The total addressable market is over 15 billion. If we capture just over 1/3 of 1%, our revenue is 59 million per year. So how are we going to get there? We're available to consumers, but our focus is partnering with hospitals. And then once we have more data, working directly with insurance. So how are things going? When we started this incubator, we had recently launched. We've been gathering momentum ever since. In terms of our current users, stress is down, engagement is up, and the platform feedback is overwhelmingly positive. We came into Caelestinus with the goal of getting 2 pilots in place, and I am happy to report we have 3. Northwell in New York City, FNHK in the Czech Republic, and George Washington University in DC. And there are 2 more in the pipeline, one of which we are talking with again tomorrow, again, thanks to this wonderful incubator. We're also in discussions to conduct a validation study with Ohio State, and we're in the process of integrating with InterSystems. We're very excited to use Iris for Health. First, we'll provide health professionals with patient engagement data to enhance decision-making. Next, we'll integrate EHR data to evaluate our impact on patient recovery and satisfaction. Finally, using AI, we'll develop personalized programs enabling proactive involvement from health professionals. There's some competition in the surgery prehab and rehab space, but our approaches are dramatically different. We excel in the user experience. Our engagement is high because we're not full of medical jargon or impersonal checklists. People enjoy using Ready, Set, Recover. We also scale and are implemented efficiently and cost-effectively via software versus expensive and inconsistent employees. And we've listened to user feedback and made the platform accessible on any device. We are the team to make this successful. I'm a wellness partnership and marketing expert who created Ready, Set, Recover because I needed it and saw others did as well. Our COO is a serial entrepreneur with several exits who's experienced starting and scaling companies. And our CTO has built tech for numerous startups, including growing a SaaS platform to 25 million in sales. We also have a wonderful advisory team of doctors and subject matter experts. Ready, Set, Recover is changing lives. That's what our participants tell us, like Tim. The calm I felt yesterday waiting to have surgery was not at all like when I had another surgery years ago. The series of thoughts and exercises truly prepared me to face something I knew would be painful. Thank you for a life-changing experience. So, why should you invest in us? We have an experienced team. Our product is desperately needed to fill the deafeningly silence that is being experienced by the millions of Tims in the world and their doctors, hospitals, and insurance companies. We've already built it and we're gaining significant traction. We're a bootstrapped company and ready to move forward faster. We're looking for a pre-seed raise of 1 million in the form of a safe note. You can book a meeting with us using this QR code, and Steve and I will gladly take your questions now.
Thank you, Heather, for your great presentation. I immediately recalled my unease and stress and frustration when I had to undergo surgery myself, and the guy who came to shave my buttocks didn't help.
Yeah.
And finally they drugged me into happiness. So I suppose that's pretty standard. No one even asked me how I felt. So let's have questions. How did you measure the economic effect of using your recovery program?
There's
Go ahead, Steve.
I was going to say there's some data on that, and it's very early days for us in terms of getting this product out there. But we've looked at the costs that are involved when patients aren't engaged in their healthcare, and what stress levels can mean in terms of readmissions, complications, and length of stay.
Fine. Thank you. Any more questions? Please keep posting via Slido. There's a hashtag final demo day, or if you're on the call, you can just raise your hand. Or if you are sitting here in front of me.
I think Matthew has his hand up.
I just have one online here. Thank you. Heather, Steve, great to see you guys again. Congratulations on the 3 pilots. I know this is more for reporting results on your incubator time here, but tell me a little bit about where you're raising $1 million on this. Jumping in yet? What's soft circled?
The first time we've been.
Yeah, Matthew, we seem to be losing connection quality. So if perhaps you could repeat your question, Matthew.
Steve, Heather, did you hear me okay?
Yes.
Yeah. I didn't hear. Details of the safe now.
Right. So can you hear me?
Yeah, we can hear you, Steve.
It looks like I'm freezing up a little bit. There we go. So this is really we had been heading to going. So this
now it's freeze and freeze, and we can't really understand. So how about
Steve? I'm fine, Steve. So I think it's probably between us and over there.
Okay. Let me turn off my.
Yeah, everybody in Zoom's doing okay.
Heather, do you want to go?
Alan just wrote in that he's doing well for him too.
I think
Heather,
we should be fine with Steve. Definitely, Heather.
Sure. So the question was, where are we in terms of raising the money? And the answer is, this is really our first pitch. We've been focused on the partnerships. The beauty of the partnerships, again, is that it gets us the data on readmissions, on length of stay, all of the higher patient satisfaction scores, the things that we need to show. And so we've been focused on that. We're very open and ready to take investment conversations, though. So this has been a great time to actually talk with people.
Great, thank you, Heather.
Of course.
Thanks, Heather. My personal question: what's the entry ticket to investing? Do you accept angels, or do you have
Either
other ideas?
Angels, VCs, either's fine.
Okay, I'm not sure whether Steve.
Oh, can you hear me?
Yes, we can hear you.
Yes.
We can hear you,
Oh,
Steve.
yeah.
That's fine.
Great.
I was saying angels, VCs, anything's fine.
Okay. There is a question for Heather. Up to 50% of patients get an infection after a procedure in hospital. Are you trying to address that as well?
So we stay on the human side. We are focused on, there's a partnership here. The clinical side, the medical team is really focused on the medical side. However, when you have a more engaged, less stressed patient, what we're seeing is the results are better. We can't control what happens in terms of the hospital side. We have engaged, though, so that a person is definitely less stressed going into it.
Okay, thank you. We still have 1 minute. Time for last question.
If we don't have a question, or until we have a question, one of the things that I will just say again along that line, though, of what you just asked, Thomas, is what we're also seeing is that this is lifting off the weight from the medical team. When you have someone who comes in, my daughter actually had surgery, and the nurses commented that having this kid who was doing breath work as she was getting an IV, you could see how that alleviated the nurses' stress and the nurses' work. So while we're doing this, while the patient is the participant, really everyone who's involved in the entire system benefits.
Okay, we have one last question. What is your go-to-market? Are you looking for pilots in Europe?
Sure.
Absolutely. Absolutely. Well, and again, this incubator has opened that up for us. So absolutely looking in Europe.
Right. So thank you, guys, for tuning in and presenting something that I wish I had a few years back. But hopefully the level of stress related to hospitals and hospital care and anything surgery will decrease and will become more bearable for us all. Thank you for pitching today, and I'm hoping to bump into you soon somewhere around the globe. So best of luck. Thanks again.
Thank you.
And Ready, Set, Recover. That was our last startup, last Caelestinus to present before a 15 minutes break. So I'll now see you back in 15 minutes, which is exactly 15:40 CET, Central European Time. So that's in 15 minutes. So grab a coffee and we'll be back exactly on time in 15 minutes. Enjoy your break. We'll be back. Thank you. So, hello again, welcome back. This is Caelestinus Spring 2024 batch final demo. And you tuned in time for our second lot. There'll be 5 Caelestinus, 5 startups pitching, presenting right now. And the first one should be NotYet. Is it Elena from NotYet? Yes, I think we can see your screen, we can hear you, so whenever you're ready. And
Great.
7 minutes plus 6 minutes question time are all yours.
Great. Hello to everyone. I'm Lena, and I'm a founder of NotYet. And I believe senior adults shouldn't die in their 60s, but live longer and better lives. With this goal, we've developed our health support system. And I'm not a doctor, clinician, or a scientist. Shock, I'm a marketer. And this allowed me to approach a huge problem from a new angle. Cardiovascular disease is still #1 killer of the elderly. I found it out when my mom faced blood pressure problems in her 60s. Perhaps your parents are facing these problems as well. There is no decent solution to monitor elderly vitals, especially blood pressure, outside the house. So physicians still get inconsistent and insufficient data for interpretation. In addition to this, the interpretation of the elderly condition is not an easy process. Elderly health like a layer cake, post-diseases, medication, side effects, lifestyle, etc., etc. And last but not least, a half of elderly patients simply don't follow prescriptions, and this significantly reduces the effectiveness of treatment. So our team decided to disrupt this situation, and in collaboration with cardiologists and scientists, we've developed a new holistic approach to solve all these problems. And we combined 3 key elements to help the elderly say not yet to their death. First, a unique health monitoring tailored specifically for the elderly. Then AI platform with medical supervision to detect risks in advance. And real-time recommendation system based on personal health history, vitals, behavioral and psychological characteristics. And our solution significantly improves the accuracy of risk identification and also gives seniors peace of mind and confidence. So, how it works? Our wristband has multi-parameter monitoring, which developed specifically for senior adults. And our method of blood pressure measurement guarantees accuracy even among the elderly with problematic blood vessels. And now patients don't have any mobility limits, while physician and the platform get a comprehensive clinical picture. Our application gives seniors control over their health and engage them in its management. And they get real-time feedback and recommendation, and of course, it's fully adapted for the elderly usage. And our platform calculates deviations and detects risks for each patient individually using algorithms and AI. It takes into account more than 40 parameters, and this allows the physician to get predictive analytics to be involved in time. And patient recommendations are also based on the same data. Our commercial strategy includes providing our solution as a remote patient monitoring with 100% insurance reimbursement, and codes for Medicare and Medicare already exists. We will offer the use of our device, app, and platform on a subscription based on a SaaS B2B business model. And at the first stage, to scale quickly, we plan to distribute our solution through RPM providers. And we are bringing our product to the large and fast-growing remote patient monitoring market in the US. In only our first year, we already developed a device and a mobile app, and we also architected a platform which we plan to deploy for pilots based on inter-system solution. And special thanks to Caelestinus, which helped us accelerate significantly. Over the past few months, we applied for FDA pre-start program and signed LOIs with our prospective partners. For the next year, we're going to finalize product development, fast-track FDA clearance to be fully prepared for commercial launch in 2025. After commercial launch, we expect to reach break-even by the end of 2026. And we plan to fundraise a pre-seed round in autumn. So if you're interested in participating in this round, just let me know and I'll give you all the details. And who makes this all possible? I combined my expertise in management and rapid business growth, and I successfully competing with Google and Uber with the expertise of my partners. My technical partner is a serial entrepreneur in medtech, and he has a huge experience in AI product development, obtaining FDA approval and successful funding and exits. And my medical partner is a cardiologist and professor at Ben-Gurion University. And of course, we have also an incredible development team. So let's work together to help the elderly say, not yet. Thank you, and I'm ready for questions.
Thank you, Elena, for your great presentation. I think we are ready to take questions. Not yet. Yes, we are. It's a really unforgettable name. Makes me thinking whether it's for me, designed for the elderly, whether I'm included or not. Is there any definition, any boundary where I suddenly become a prospective client for your lovely bracelet?
Yeah, it's really lovely. You can see my mom already improved it. And of course, we will be happy to test any other segments. But probably one of our advantage is that we fully focused on the elderly segment. And starting from the design and finishing with some features of our platform, we are fully prepared for interpretations, specifically elderly conditions. Of course, it works even for young people, but we'll decide to start from this segment. And probably it's the most growing segment now at the market.
Right. We have first two questions on Slido. So, will it work with Apple Watch in the future? And if not, why?
There is one indicator which is absent in Apple Watch, and it barely will be there. I talk about blood pressure, and we use oscillometric method to guarantee accuracy among the elderly. And this means that we have a cuff under the wristband. So we suppose that it's hardly to find the same solution on the market, especially through well-being watches like an Apple Watch. Probably they will implement an optical method of measuring blood pressure, but it's not suitable for the elderly.
Fine. Another question. Who usually pays for the wristband?
Could you please repeat?
Who pays for your wristband?
Who pays? Yeah. So our business model includes insurance reimbursement, and the payer will be Medicare and Medicaid. If regarding the United States, market. But now we just signed a pre-contract with Uganda Ministry of Healthcare, and there will be another scheme. It was partially paid by patients and partially paid by clinics. So we are quite flexible for these payment solutions.
Right, more questions? Anyone here at EChem would love to appear on stage, or anybody on the call can ask questions. Me personally, I have seen a lot of wristbands based startups, and one of the issues with designing for the elderly is that nobody wants to wear something that communicates, I'm elderly, I can't have the cool gadgets, I need the big wristbands. Have you encountered this issue when researching and doing design thinking kind of workshops with your target audience?
Yeah, absolutely, for sure. We conducted a survey among the elderly in the United States, and we tested different designs, and among men, audience, more sportish style won, but overall, this design was the winner, and among women and men. So we decided to choose this one. Yeah. And I can't say that it looks very unfashionable. It's really cool. I really like to wear it.
We have a last question for Elena. Where do you plan to manufacture your device?
Now we plan to manufacture our device in China, but assemble it in the United States.
Right. So it's the road that Apple takes, you know, design in the US, manufacture in China. Okay, we have 1 last minute, so anyone can fire a question. Otherwise, Elena, also you can use this time. We do not have a question yet for some final statement, call to action. So maybe you could recap what you are looking for at this moment. What's how we can help you?
Great, thank you for this opportunity. So firstly, we are searching for new partners for piloting, because we just developed our MVP of product. And the second, we would be really happy to discuss with our prospective investors opportunity to fundraise. And we just signed the first safe check. Before that, we were a bootstrap startup. So, of course, we need some more fuel to develop quicker.
Okay, thank you. And if you could repeat once again how much money you are raising at the moment?
We are preparing for pre-seed round, and we are planning to fundraise $2 million.
Okay, thank you. So I hope the 2 millions land immediately after the end of the final demo. And thank you, Elena, for your great pitch.
Thank you. Great.
Thank you.
Bye.
It's now time to move forward with our pitches. So we should have Zach from Marymount Labs online. Zach, where are you?
Hi.
Excellent. You are there. We can see your screen. Go ahead and make an impression.
Good afternoon. I am Zach, founder of Marymount Labs, where we are strengthening patient engagement for preventive health, starting in Singapore. You might know that Singapore is one of the most expensive cities in the world. But what you might not know is that Singapore's vaccination rates are less than half of what the UK achieves for influenza and pneumococcal. The same pattern plays out in chronic disease management and cancer screening, the key to ensuring healthy longevity and lower healthcare costs. In Singapore, without proper preventive health management, the cost of chronic disease burden can exceed $12,000 per person annually. So why is it so difficult for clinics to engage patients effectively in their health? Today, clinics contact each patient by phone or email, which is manual, tedious, and impossible to scale. Some other clinics have adopted batch messaging and chatbots. Yet, these tools only notify patients about services like vaccinations without changing the underlying behavior. Government-led public health campaigns aim to educate and modify behaviors. However, they are infrequent and not personalized. There is, therefore, currently no scalable solution that actively engages patients and effectively modifies their health behavior. We have established that the patient engagement process at clinics today is inefficient, superficial, inconsistent, and lacking in continuity. Due to these shortcomings, healthcare outcomes are compromised, marked by low uptake of clinical services, poor chronic disease management, and weakened trust between patients and doctors. Therefore, healthcare needs a fundamental rethink of how to engage patients effectively. Marymount Labs has developed Broadcast, a no-code platform that transforms patient engagement. This platform allows clinics to design, launch, and monitor personalized activation campaigns over WhatsApp. Clinics can engage thousands of patients simultaneously with targeted messages tailored to the patient's background. We are simplifying campaign design through composable blocks tailored for healthcare communications. Our campaigns include foundational conversation blocks such as identity verification, informed consent, and appointment scheduling. Clinics can also design their own custom blocks for specific health campaigns. These include options like multiple choice questions, infographics, and call to actions. Each call to action can prompt patients to book an appointment or contact the clinic directly, increasing preventive health service uptake. One of our foundation blocks is the informed consent block, a critical component for nearly all health campaigns. This block automates the process of collecting consent via WhatsApp, enhancing both efficiency and compliance. Clinics have expressed a high demand for this feature, appreciating the ability to securely manage patient consent digitally. In this demo, we start by filtering our target audience based on demographics. Our goal here is to design a campaign aimed at boosting colorectal cancer screening rates. Clinical staff can easily build conversation campaigns with our intuitive drag and drop interface. They also have the ability to create custom templates that include multimedia options. Moreover, users can set different pathways that each conversation might take depending on the patient responses. Once the clinical staff is done with creating these workflows, they can then save the conversational campaigns. The campaign can then be deployed simultaneously to multiple patients. Once launched, the automated conversations will proceed at scale. Patients can then sign up for preventive health services over the WhatsApp chatbot directly. Broadcast is transforming patient communication by offering a wide range of activation opportunities for clinical services. This versatile platform supports everything from referral to clinical services to comprehensive patient education campaigns. With Broadcast, clinics can effectively manage diverse aspects of patient engagement, all through a single powerful platform. Recently, we launched a colorectal cancer screening campaign with a partner clinic modeled on A/B testing principles in digital marketing. Our advanced suite of analytics unlocks a new paradigm of conversation insights. For example, we can drill down into specific conversation notes to see the profile of responses. We also developed our metrics to measure hesitance, aversion, compliance, and so on. Across the conversation, we have developed proprietary analytical techniques to reveal non-obvious insights. All these enable campaign optimization, such as the ability to tactically adjust specific messages to achieve better campaign performance. We're excited to share that we are supercharging our dialogue planning with generative AI. We use LLMs to craft personalized messages before the campaign to target specific patient groups. During the campaign, the models can generate dynamic responses based on the dialogue history. After the campaign, Broadcast analyzes the interaction data to generate comprehensive reports. These insights enable us to optimize future campaigns by refining message accuracy and timing, ultimately leading to more effective patient engagement and better health outcomes. We developed Broadcast in just 6 months through bootstrapping. Our team has experience in AI and data engineering with publications in leading AI and medical journals. We also bring experience in developing clinical studies and managing medical grants programs. We are also advised by strategic clinical partners in Singapore with decades of experience running GP clinics. Our immediate market is the primary care segment in Singapore at 12 million ARR. We sell to GP clinics on a subscription model, and we have an ongoing pilot with a network of 60 GP clinics in Singapore. We are also in discussion with 2 global pharma companies to potentially develop campaigns to support their multi-channel engagement efforts. We project strong growth and are targeted to expand into the US market by next year. Our product development roadmap also includes entering adjacent verticals such as outpatient specialists and wellness markets. We are completely bootstrapped, and we plan to raise a pre-seed round in the end of this year to supercharge our product development and business commercialization efforts. Thank you.
Thank you, Zach, for this great patient presentation. I personally impressed by the journey and the work you have done in the last 4 months. I still remember you from the interviews, so this is amazing. And congratulations. Now, question time. Again, you can use Slido, or you can ask here at eCam or anyone on the call. Maybe I'll start. I'll kick it off. Have you tell us something about your experience talking to hospitals, healthcare providers, maybe not just in Singapore, but the US or the rest of the world, because part of the Caelestinus program is to make sure you can scale globally. So have you succeeded in that, or what was your experience?
So our immediate BCH market is still the Singapore primary care ecosystem. We believe there is tremendous value to mine even within the small market of Singapore. We are using this time to really validate our product both technically and commercially. And that includes understanding who the end users of our product are. These are usually the clinical admin staff who work at GP clinics, who are usually overburdened with a myriad of decisions involving related to care coordination. So a no-code platform that simplifies patient engagement communications would be something immensely valuable for them. We do hope to expand into adjacent markets, including in Southeast Asia, as well as in the US. That would definitely require us to develop and nurture partnerships. And we think that InterSystems is a very good starting point for that.
Okay, guys, thank you. So let's have questions. We still have about time for 2 questions. So maybe I have one more question, which is my experience from hospitals in Central Europe is that it's very hard for medical professionals to be good campaign designers. And I understand that your solution offers opportunity to design campaigns without any specific knowledge from communication strategy, segment, messaging, etc., creating the right mix of media, etc. Is it the case that, for example, in Singapore, hospitals are better at designing communication campaigns, or is it something that, as here in Prague, most physicians really hate to do?
I would imagine that the pain points are the same between Prague and in Singapore. I don't think clinicians or even admin staff would like to spend the end of their workday trying to design a campaign from scratch, which is also why we're trying to tackle this using a no-code platform. We really want to break down the conversations into the fundamental building blocks, and that includes things that are very boilerplate, things that are very mundane, but critical for a conversational campaign. These include collecting informed consent. This includes generating the infographics to educate patients on this preventive health service. And it also includes call to actions that are linked to the clinic's backend. We're also using large language models to supercharge this entire process. We want to make it pain-free as much as possible. And the long-term vision for this is really to develop a library of public health campaigns that can be used by not just a specific clinic, but clinics all over the world, hospitals all over the world. And we think this is a great opportunity to not just partner with clinics, but also pharmaceutical companies in their multi-channel engagement efforts.
We have a question for you relating to attitude of users to using different messaging apps. So there are some countries where it's fine and trusted to communicate through WhatsApp. Some countries or some hospitals also prefer to build their own applications and communicate through those. So what is how do you plan to address this disparity between perception of different messaging apps globally?
So the perception problem is indeed something very important, something that we have considered. At least in Singapore, WhatsApp has the highest penetration. It's also a channel that companies, even government authorities are using to engage with people in use cases outside of public health. Establishing trust is very important, which is why we have streamlined the operational process of creating a verified account on WhatsApp when communicating with patients, as well as ensuring that each message establishes the authority and the purpose of the messaging. In other countries, WhatsApp may not be as acceptable a messaging channel. We would have to understand what the local regulations are with regards to using WhatsApp to engage with patients, what the informed consent procedures look like, as well as whether there are other messaging channels available, perhaps through the clinics directly or the hospitals directly that would come across more authoritative.
So thank you, Zach. That was a great pitch again. And I hope that your campaigns will once rule them all, meaning all hospitals, based on the experience that you will have amassed by that stage. So thanks again. Thanks for being part of Caelestinus, and best of luck. So thank you. Thank you a lot, Zach. We'll be here moving on. We have a busy agenda, and I think the next on the list is none other than Coredio. Coredio. We should have Yashar.
Yes, hello everyone.
Hello, nice to see you again.
Good to see you, everyone.
Okay, so we can all see you, hear you, and I'm sure you will share your screen, Yashar. Yeah, looks excellent, perfect. So whenever you feel like it, go ahead.
Sounds good, and you can hear me well?
Perfectly.
Okay, perfect. Hi everyone, this is Yashar. I'm the co-founder and CEO of Coredio, and here is with me also Mehdi Mortazavi, my co-founder and CTO. Glad to be talking about Coredio today with you. So at Coredio, what we do is basically real-time escalation avoidance for heart failure patients. And the way that we do it is with our patented technology that allows us to non-invasively measure some of the cardiac signals that are only available otherwise through catheterization or echo. And those are not always available throughout the patient journey for heart failure patients. So I'll be talking a little bit more about that and what we are actually targeting. So heart failure is a very huge problem, both in US and globally. 6.7 million people in US suffer from heart failure, 65 million in the world. And there are a multitude of problems with the heart failure, patients, the care of them. And one of the key ones that we are targeting is the fact that some of the measures for cardiac function are needed to be done only through either catheterization or echo, which are invasive and expensive, as well as they're not always available. So 40% of patients actually don't get timely catheterization or echo. And that leads to them going home without a complete basically diagnosis. Another problem is that these patients get discharged usually with an arm blood pressure cuff and a scale in order to continue monitoring themselves. But both the compliance is a problem. Patients don't really comply with that sometimes. Another is that these two devices are not really representative of the patient's condition. So that results in a 50% readmission of these patients. So you can imagine 50% of these patients come back to the hospital after discharge. And 23% actually come back in less than 30 days, and it can lead to very significant negative outcomes. Some people have mortality, some people come back to ER and so forth. And that created a $4 billion problem in the US and $10 billion problem around the globe. So there is a solution for this. There are studies, especially CardioMEMS studies and others, that are showing that if you can measure some of the cardiac output and intracardiac pressures for these patients throughout their journey, you can reduce this readmission by 19%. And that means better quality of life for the patients, as well as this is a point of care solution that can help both the hospitals, which are the healthcare providers, as well as the payers, because now they will be saving the cost of readmission, because currently the cost of readmission is either burdened by the hospital or by the payers. And what we're thinking is that if we can provide such a solution, accountable care organizations and those that are focusing on value-based care are the first target that can really benefit from this. And at the same time, for fee-for-service environment, payers are really incentivized to use this type of technology. So there are some companies that are already trying to do this. And as I mentioned, the standard of care currently is really expensive and invasive and not really accessible. So these companies that are trying to do this are mostly creating devices, mostly creating technologies that are using generalized AI models. However, what we learned is that the doctors don't want a new device. The doctors don't want workflow change, and they want something that can be patient-specifically, giving them really accurate results. That's where we come in. So at Coredio, we're building the SaaS platform that enables accessible monitoring of these specific metrics that can reduce readmission. So what we do is very interesting. So what we do is just be a software play without any device. We connect to the devices that the doctors already own in the office, such as a blood pressure cuff, such as a pulse oximeter, as well as the ECG. We connect to these devices, take data in office, and when the patient goes home, we connect to their wearables, such as Apple Watch and Samsung Watch, as well as a blood pressure cuff. We take that data, and we have a patented algorithm that allows us to extract a digital twin of their arteries. And this digital twin plus our AI model allows us to, with very great accuracy, extract the cardiac output and intracardiac pressure for these patients. It is fantastic that now we are able to basically use this technology, and what we're hoping to do next is, and we are already in talks with InterSystems, is that we use some of the interoperability tools that InterSystem offers in order to make this widely available in the EHR systems. So everything will be talking with the EHR and quickly being reported to the doctors. So you can imagine that what we're trying to achieve is that now we can report cardiac function and incidence directly to the doctors and as well as to the patient, and create actionable insight whenever the doctors actually need them most. So we can tell them if there's an event, there's a threshold that's now their cardiac output drops lower than a threshold, or another cardiac function drops lower than a threshold, we can inform the doctor so that they can intervene, change the medication, or basically they can call the patient to schedule a visit. So this is a quick demo showing the capability on an actual Samsung watch that we were able to develop during this time at Caelestinus, actually, and also by talking with Samsung. So here you're seeing we're actually extracting the real-time data for PPG or pulse ox signal, as well as the ECG or electrocardiogram. And we have the systolic and diastolic pressure coming from the blood pressure cuff. And what is showing on the right side is that in real time, we can measure the cardiac output and blood pressure, central blood pressure. This is the aortic blood pressure. So now the person here went away, they did some exercise and they come back and they want to do another measurement. And we can show that even in an elevated condition of heart rate, elevated blood pressure, we are able to track this cardiac output and intracardiac pressure. So anytime during the patient journey, we are able to provide these information and let the doctor know if something doesn't look right. So this is a huge market, and what we're thinking is that we have a $1.4 billion segment that is addressable for us. And we think by the time of a potential exit, we would be having a $133 million revenue. The incentives are the fact that for doctors, we create cost sharing, relative value units, as well as in case of the accountable care organization and hospitals, the readmission reduction is the incentive. And for nurses and staff, reimbursement for RPM is the incentive. So one of the examples that we calculated is that we are able to provide a $30 million saving, for example, for a Maine medical center in the state of Maine, because of the size of the hospital and the number of cardiologists that they have, just by introducing Coredio to their workflows. So we had tremendous traction so far, and our plan is solidly
30 seconds.
Sure, thank you. So what we achieved is so far, we have patents, we have publications and algorithms, grants in place. We are doing validation studies already, and we have clinical partners. And our roadmap starts with our pre-seed raise, doing the FDA pre-submission and getting the FDA by 26. And then we have multi-center studies that are planned. So we aim to become the hemodynamics 2.0 in future. We have a fantastic team of engineers, cardiologists, and great advisors that are helping us achieve this. And we have great partners in terms of both medical partners as well as some of our early investors that are helping us achieve this. So far, we've been in 5 hospitals, and we're trying to expand that. And this is what we're doing next. We're raising 800K with a 6.5 million post-money cap to achieve our pre-seed round goals. Thank you so much, everyone.
Okay, thank you, Yashar. Great page now. We have 4 minutes question time, so I'm checking the Slido. You can use Slido with the final demo day hashtag, or if you have a question and happen to be in ACAM, please join me on stage. Ask Yashar directly from here.
Yeah, Tomas, I have a question online here for Yashar.
Sure.
So thanks again for that presentation. I don't want to get too technical here into the weeds, but you're trying to do something pretty monumental here, which is supplant the standard of care for, or the standard diagnosing for, a major medical condition. The gold standard for diagnosing heart failure, as you know, is echocardiogram and a couple of other tests.
Yes.
And so I'm just trying to understand how you'll replace that with what I'm guessing. I don't know enough about your algorithm, but it looks like you're looking at cardiac output as a proxy for ejection fraction. Is that the correct way to think about it?
So this is a great question. First of all, so what we're trying to do is the cardiac output is one of our outcome measures. So these are the metrics that we can actually measure. So over here in this slide, what I'm showing is basically we can measure cardiac output precisely, and then for ejection fraction, we can start with a baseline and show the trends of change for ejection fraction. So
but in that chart you showed earlier, where it was kind of moving left to right on the cardiac output, you were basing that on your PPG measurement, right? So it was a kind of VO2 calculation or something. You're looking at the oxygenation of blood, and you were making a small calculation, kind of seeing how it moves, right? But it was inferring. It's not a direct measurement, correct?
By direct measurement, what do you mean by direct measurement?
Again, without going too far into the weeds here and boring everybody, the gold standard is ejection fraction and a couple of other parameters, right? So that's measured with ultrasound of the heart. You get a percentage of ejection fraction, and you can detail how effectively the heart is working. You stratify the patient into, NYHA class 1, class 2, class 3, and then treatment it goes forward. So tell me about what you're actually measuring, and then what you intend to do with those results, because we're really not supplanting or replacing ejection fraction. This is kind of, it almost seems to me like an earlier test that you might do to stratify patients, but you're not going to actually ever anytime soon get rid of the ability or need to do echocardiogram and those other tests that are more robust to diagnose a patient with heart failure.
Yeah, so let me clarify. So we are not aiming to replace echo or catheterization. What we're trying to do is we're trying to say there are a lot of instances that echo and catheterization are not available. We want to be there for the doctors to use us at that point. So 40% of the time, that's not available. When the patient goes home, that's not available. We can provide this cardiac output, ejection fraction, intracardiac pressures, non-invasively for them. And we so far showed 95% accuracy on doing that. And the way that we do it is not simply by just mapping a PPG to like a cardiac output. We're actually creating a digital twin. We're actually simulating the physics of the arteries and understanding if we're seeing signals at the wrist, can we back calculate what happened at the heart that now we're seeing this signal. So we are actually measuring the pulse propagation starting from the heart to the rest of the body.
Via PPG on the wrist?
Via PPG, ECG, and blood pressure on one of the arms of the patient. Yeah.
Okay, so there's an ECG component as well, and a blood. So you need a blood pressure cuff as well. Okay.
Yes.
That starting to make a little more sense. Okay.
Yeah. I would be happy to talk more in future if you're interested. There's one more question from Alfred, it seems.
Yeah. I don't know if we still have time, but yeah, sure. Thank you so much for the great presentation. I really think that this is the future of medicine, and yeah, just very grateful that you're advancing it for us. So my question is, and I actually have two questions. I don't know if you will be able to answer both, but first question is the regulation. Do you need an FDA clearance for a medical device or anything like that for you to operate? And second question, you mentioned that it saves a lot of money for the payer, but who is the payer in your case? Is it the insurance company? Is it the hospital? Or is it actually the patient?
Great questions. Thank you for that.
Yeah, sure. Make it really brief, your answers, please, if you can.
Sure.
Yeah.
So we have a 510K pathway, and we are already gearing up for that. We have a team of FDA advisors that are helping us achieve that. For example, Dave Shoemaker is our lead FDA advisor. He's a very well-known person in the space. And then in terms of basically the payers, our initial target is ACOs or accountable care organizations. They will be incentivized to do that because if they reduce the readmission, they can save the extra money basically as the return of investment for themselves. And then for case of after the 30-day readmission, insurances are excited to do that because as the patient comes back to the hospital less, they can save money. Thank you.
Okay, fine. So thank you, Coredio, for your pitch. that expert discussion you had. It's hard to say. I didn't understand the word, but I think you solved it. You can also use slido.com to ask further questions aimed at any of the startups you have heard. And you are, of course, free to take your discussions, continue with them outside the demo day. So we have 2 more to go before another coffee break. And now it's my pleasure to welcome, hopefully, Anton online from Heuristik. So let's get a visual and audio on Anton. Ahoy.
How are you doing?
I still can't. Now I can see you, Anton. Excellent.
Yeah.
Ahoy again.
Still alive.
Ahoy again, and whenever you're ready, your 13 minutes of glory. We can see your screen. All fine on our side.
Okay, so I can move ahead. So as Thomas said, my name is Anton, and I'm the founder and CEO of Heuristik. And today I'm going to show you why Heuristik is going to be the next European unicorn. So basically, this story began 4 years ago when a nurse almost killed my grandfather by making an identification error. So basically, they thought that my grandfather was another guy and provide him with the incorrect drugs. Like my grandfather, in Europe, more than 500 million patients suffer from identification errors every year, with a market cost of over 200 billion euros. In the US, over 600 million patients suffer from identification errors every year, with a market cost of over $1 trillion. But where are these identification errors happening? So these are the 3 main identification error areas. The first one, for example, I'm not going to go to both because we don't have enough time. But in Europe, over 55 million patients receive the wrong drug every year. Over 500,000 patients receive the wrong operation every year, and over 110 million patients wear the wrong bracelet every year. You can guess. The main problem here are the current patient identification solutions. But why? In the case of the healthcare cards, are the #1 fraud solution because patients swap them. In the case of the identification bracelets, they have printing issues or they wear off, so it's basically super difficult to scan or read the name. Then there are some patients that refuse to use the bracelets. This is especially an issue with people with mental issues. And of course, healthcare staff can provide the wrong bracelet to the patient. In order to solve this huge problem, we have created Heuristik. Heuristik is a software solution to identify and manage patients using fingerprints and artificial intelligence. But our technology is not just about identifying patients. We also help with the management and with the tracking. But I will explain it later. So basically, this is how it works. You go to the healthcare entity, they scan your fingerprints, then we link your fingerprints to the medical record, and voila, every time that you put your fingerprint in the lector, you are going to get perfectly identified. The magic behind our technology is in the artificial intelligence, because basically we are able to identify fingerprints in adverse situations, for example, wet, dirty, or blood stain, with a 92% of accuracy. This means that we have like 100% of accuracy. This 92% means that we can say that 2 fingerprints are similar with a 92% of accuracy, which basically is 100% of accuracy. And then what I mentioned before, we also provide real-time data, like how many patients are coming per day, per month, per year to a healthcare entity, how much time does it take to make every process, or the tracking, where the patient is located in real time. If we combine identification, real-time data, and tracking, we are able to avoid bottlenecks in healthcare entities. We are GDPR and HIPAA compliant because we never have access to patients' information. Our business model is a B2B SaaS, so basically we charge per identification. We are able to identify, to implement our technology in all healthcare entities, like hospitals, insurance companies, pharma, etc. So currently we have closed 12 hospitals in Europe, in 6 different countries across Europe, and 1 in Israel. Since Caelestinus, we have closed almost 6 to 7 hospitals since we started. Also, we have closed the European consortium to apply the EIC accelerator, which is the largest grant in Europe, and we already have 9 hospitals closed for this consortium. The EIT Health have selected 10 European companies with more chances on obtaining this grant, and we are one of them. And of course, we have over 20 prospective customers in Europe, the US, and Israel. Thanks to Caelestinus, we added 4 more hospitals to this list, and maybe today, cross your fingers, we will be closing 1 hospital in the US. Then our team is amazing. So myself, I am a serial entrepreneur with 1 successful exit. Tatiana has been working 15 years for Novartis and also right now works in a VC firm in Boston. Ruben is a serial entrepreneur with 1 successful exit as a CTO. And this is the rest of the team. The guy developing the artificial intelligence is a PhD in artificial intelligence specialized in image recognition. We've been part of the largest healthcare acceleration programs in Europe and in the US. We also been in Taiwan. We've raised over 750,000 euros, mostly in grants and awards. So we bootstrap everything, basically. We are targeting a market that is valued in 81 billion and is growing at 19% every year. We are raising 1.4 million, and we already have 550,000 closed from 3 VCs. One of them has taken 3 healthcare companies public. Basically, we see ourselves as the leading healthcare biometric company in Europe in 2 years and starting to launch our technology into the US. So basically, you have 2 options. You can help us reduce the ID errors statistics by investing on us or implementing the technology in your hospitals or making some intros, or you can run the risk of being part of them. Thank you. And before I give the stage to Thomas, just one thing to say, we are launching a healthcare crowdfunding campaign. You can scan this QR code and invest on us directly. So that's all for my side.
Well, thank you, Anton, for your great pitch. Now it's question time again. So before things get heated up on Slido, my question is, Anton, I happen to know a bit about your product and solution, but perhaps a natural question comes into mind. Is it a replacement of the traditional wristband system altogether, or is it an alternative? Can you maybe comment on how it compares to and works with existing patient ID systems in hospitals?
Sure. For me, something to remark is that when we started talking in Caelestinus, you told me that it was the first healthcare biometric company that you knew. And suddenly, we combined it, what I was saying, what would happen in 1 hospital, so you could see the value of the technology, I guess. And yeah, we are not trying to replace the bracelets. We want to be a combination. Because, for example, some hospitals use color bracelets to know the urgency on the patient care. So basically, we just want to be an additional feature so the healthcare staff can be convinced that that's the correct patient. And also, we are able to identify patients in situations where the current identification solutions don't work. For example, if a patient comes with no identification to the healthcare entity, if you previously get identified with the fingerprint, voila, you will just put the fingerprint when you are unconscious in the healthcare entity and they will be able to identify you. And also, if they provide the wrong bracelet or you lose the bracelet during the patient flow, they will just put the fingerprint in the lector and get able to identify you. So we are like a kind of a backup or a technology that is combined with the bracelets in order to assure that basically you are identifying the correct patient every time.
Okay, we have a question. What biometrics do you use to ID a patient? Well, my understanding is it's the fingerprint, but maybe you can expand on how this is done and how this is kept secret and compliant with the European legislation or other personal data legislation around the world.
I mean, we are not Facebook, so we are not selling your data for money, and we will never do that. So basically, we choose fingerprint technology because that's the only technology that is gonna work in healthcare. Because, for example, face recognition is not working with twins, or even if you have like your face damage or whatever, it's not gonna work. And the same with iris or other healthcare technologies, like identification technologies. In our case, we are using fingerprints, and we are one of the first companies in the world that has created an artificial intelligence, a neural network, able to identify these fingerprints in adverse situations. I know it doesn't sound new, but when you talk with these biometric hardware manufacturers that are making 300 million plus a year, they never seen something similar. And the value of our technology is that we can work with all the healthcare hardware, like all the biometric hardware companies in the market. And that's the essence of Heuristik, that basically we are super focused in this fingerprint identification technology.
Thanks. We still have time for 1 or 2 questions. So anyone? Maybe my question would be, what is maybe you mentioned the cost of identification mistakes, but is there like an average cost or median, or what was the largest cost ever to a hospital or healthcare provider that you have come across?
Well, in the US, there are some cases of millions of dollars, like, for example, providing the wrong kidney to the patient, cutting the wrong leg, or basically, or making like a wrong identification case. So in our case, we are not just less expensive than the identification bracelets, but also we reduce those identification errors and we make the processes more agile. So that's a win-win for the hospital.
Excellent. You have last minute. Maybe you could make a final point or call to action, as is customary with pitches. So the floor is yours for 60 seconds, Anton.
Yeah, no worries, Thomas. Yeah, so as Thomas mentioned, if you are interested in our company, in Heuristik, you can reach out to us, and for sure we can have a meeting. But remember my words. If it's not today, in 10 years, there is going to be one biometric company in hospitals, and hopefully it's going to be Heuristik. So do you want to be in our side or in the other side? So yeah, thank you for having me.
Thank you, Anton, for your great pitch. I'm looking forward to the day where I'll be fingerprinted. It's very hard to answer questions when they ask you just before the surgery about 3 times, who are you? They check the information, but when the drugs kick in, you can give them anything. So hopefully, also people having the same first names and second names is not so uncommon. So hopefully we'll avoid these tragic mistakes. Now, you're still awake. Who is asleep? Nobody. That's amazing. I mean, if you saw this audience that is in front of me here in Prague at the Institute of Clinical and Experimental Medicine, that's amazing. They are all shouting, waving, and looking, and looking forward to our last pitch presentation before coffee break. And I'm so happy that it's Marco, who I briefly saw. Marco, hello. Again.
Hey, how are you?
I'm fine, I'm just getting started, and I'm so happy to have you here. Marco from ROOK, but Marco is no way a rookie. Is that correct? And I'm so happy to see you again. Unfortunately, we are not having this amazing breakfast that we had together last time. But, it's not bad. I'll have a great party afterwards. What about you?
That's great. That's great. Definitely. It's not the same thing, but definitely we will see each other together next time, I think the next year, right?
Yeah, great. But anyway, so 13 minutes are yours, and whenever you're ready.
All right. Let me share my screen. I hope not.
All fine. All fine.
All fine?
Yeah.
Perfect. Perfect. Well, thank you very much. Very excited. This is the demo day. It's the last day. 3 months of intensive meetings and everything. So very happy to be here. I'm Marco Benitez. I'm one of the co-founders. I'm the CEO. Also, Jonas is here, the COO and co-founder. And quick introduction about myself. I have 17 years of experience in the healthcare industry, mainly in data. I'm a biomedical engineer. I have a second degree in biomedics. This is my second startup. My first startup, I get an exit in 2006 and start working in the big pharma, clinical trials, data, love, again, data. And let's start. ROOK, what we do you know that the FDA and other agencies is starting to approve the wearable devices, these wearables, as a medical devices? That was huge. But also the FDA approved to use the information of the wearables in the medical records. That also changed a lot of stuff in the industry. So you can imagine industries like fitness, wellness, big pharma, clinical trials, healthcare, and other insurance companies trying to pull the information from these devices that are approved by the FDA. However, they are facing two big problems. The first problem is that there's tons of wearables in the market. It's the Apple Watch, the Whoop, the Polar, Garmin, Sunto, Huawei, Xiaomi, and with things, and every single month it's a new wearable in the market. So these companies have to integrate one by one. They have to pull the API and maintain those integrations. Maintain the integration, it's a huge effort. Again, these wearable devices have a monthly updates in these integrations. So the companies have to maintain the integration. Secondly, is how to manage the data. When you pull the information from different devices, the information doesn't make sense when you are trying to do something with the data. Quick example, the date. Some wearables will give you the information as day, month, year, and the other ones as a month, day, year. And just because of that, you can't use the information. It's an easy way to explain it, but imagine when you have blood pressure, stress levels, sleep data, glucose levels, or even steps. You can, believe me, the steps are completely different between different wearables. So that's exactly the problem that we are solving. We are building the stripe or the plate for the wearable health data. What we do, we are something called an API. So in our API, we are just a code. In our code, we already have 300 wearables integrated in our API. What does that mean? Basically, our client, this, let's say, insurance platform, they only have to integrate our API, very easy, straightforward, instead of integrate 300 wearables or 10 or 20 wearables and maintain those integrations. They only have to deal with us, and that's it. We manage all the relationship with the other data sources. Secondly, and even more important, when we extract the information from wearables, health kits, APIs, medical devices, etc., we manage all the data. We standardize, we harmonize, we take out the duplicity, and then we deliver the data in one endpoint, very clean and structured data. So our clients can use the data very easy going, and that's it. In terms of security, we are HIPAA compliant, GDPR compliant from Europe, and even more important, we are also FHIR compliant. So we work actively with InterSystem and with Iris. But who are our clients? As at the beginning said, there is a lot of industries that want to pull this information. We focus all of our efforts between two industries. One is with the digital health space, mainly chronic disease management, telehealth, and remote patient monitoring. They want to track the 24/7 hours, the information. InsurTech, they are looking for life insurance, health insurance in something called underwriting process, and for engagement purposes. We have some clients using for that purposes. Those are some front ends, our examples, how our actual clients are using our API. As you can see, the between these ones are completely different, and that's because we don't have nothing to do with the front end. We are just behind, so we are just the code, and they implement the front end. This one is for oncology, Advanta Health Solutions is with insurance companies, RPM in remote patient monitoring, and again, complete different, and they use it for different situations. In terms of traction, it's a very good one. We already have 30 clients signed, and all of them are integrating our technology. Well, that's a mistake. 27 clients are integrating our API. However, 3 of them are already alive, and we already have 100,000 of active users passing information through our API. So we have a lot of data. We are doing a lot of very good stuff with these only 3 clients. Imagine when we have the other 27 clients activated. And also very important to say here is that we have 3 clients starting to integrate Iris and ROOK at the same time. Which ones are? One, we are working with ACHA, which is a health ecosystem. The other one is a CRO for decentralized clinical trials. It's a phase 4, and one of the endpoints is with the wearables information, and they want the data delivered with FHIR. The other one is a very big one, health system here in the US. I can't say the name. I really want to, but I can't. But it's a big one here, and we are very excited about this because they want to track the information patients and put it directly in the e-charts. And this is the team. We are 25 people working together between US and Latin America. The 75% of the team is developers, product, and data scientists. And we came through Caelestinus, Techstars, Endeavor. We are based here in Miami, and everyone is very seasoned in terms of the experience in biomedical engineers. Some of them, like Daniel Martinez, is focusing artificial intelligence. Well, at the very beginning, machine learning. So very, very excited what we are building. This is our pre-seed round. We raised last year $2 million. Those are some of our actual investors. The one who led the round was New Fund. And of course, we are I'm proud to be backed by InterSystems. And yeah, we open a plus round. In this plus round, we are raising $1 million, which we already have 750,000 already committed. And yeah, we are adding some members in the data side because we have to bring the data in a very different way with insurance, with the big farm, and with the healthcare. So that's why we opened this extension round. And yeah, if everyone wants to join us, please let us know. We will be more happy to have you here and in this exciting moment that we are right now. Thank you very much for the time.
Thank you, Marco, for your great pitch. I have first question via Slido. What is the pricing model?
Yeah, the pricing model is very straightforward, like any other API companies. It's a license fee of $4.49 plus 10 cents per active user.
Okay, so that's per user model.
Per month.
Yeah, per month.
Exactly, per month.
Okay. Questions?
Hey, Matthew.
Hey, Marco, great to see you again. Maybe
definitely.
Just a little more color on that clinical trial use case, which I'm pretty excited about. Love hearing that you've got something underway there.
Yeah, well, basically they are looking for, it's a CRO who is looking for different phases in this vaccine. And one of the endpoints, the protocol they have is one of the endpoints is with the wearables information around temperature and HRV. And It's reasonable, right? Because at the end of the day, one of the safety reasons is always temperature, and they are looking for different devices. The only thing they are looking, not sure if they are going to use like 3 wearables or they are going to use any wearable in the market. But yeah,
that's great. And on the integration, is it real time temperature reporting, or is it collected per visit?
it's collected per visit, so they are going to pull the information. But the important thing here is that the patient doesn't have to be in the site. They can be in other place, so they collect the data.
That's great. And is the company paying you per patient per month or per data point? How does the contract look?
No, we are doing something different with them, and it's going to be per service. So it's not something around the end users. It's all around how we manage the data completely for the whole process.
Perfect. We'll dig more into that later, but thank you. That's great news.
Yeah, thanks.
Questions? Still accepting questions? Yes, Tomáš, please. Here in ICAM, we'll have Tomáš is running down, picking which color is it? The blue mic. Yeah, that's Honza's mic. He's not here.
Hi, and thank you for a nice presentation. I have one question. How keen are the providers to give you access to their API?
Sorry, I didn't catch the question.
I can jump in here.
Okay.
It's Jonas here from ROOK as well. I got the question. So generally speaking, we have seen over the last few years a trend towards interoperability. So all the different data providers have been opening up, building open APIs, open SDK stacks that you can plug in. Some are still sitting behind some partnership agreement or developer accounts, etc. But we have seen, generally speaking, a trend towards interoperability because they understood that if the data can travel outside of their ecosystem, it can add extra value and provide them with a broader reach of like their devices, because most of them are actually hardware companies and not so much focused on the software side of things. I hope this is answering the question.
Yeah, thank you.
Awesome. Okay. Thank you, guys. We still have 1 minute. Last question, probably. If there is none, I have a question. It looks like you are US focused at the moment, but what about Europe? And we have this European health data space legislation, coming soon, and everything should be interoperable and standardized. So it might be a bit easier for you to do business in Europe.
Yeah, definitely yes. Even though that we are focused in the US, surprisingly, we have a lot of clients in Europe. So definitely, because we are an API and we are GDPR compliant, HIPAA compliant GDPR from Europe, so definitely we can job and have more clients in Europe. And we are doing something very interesting over there, but happy to go deep in a different call, but we have something interesting in the next months over there.
Okay, so it's been a pleasure, guys. I have just seen a glimpse of Jonas also waving. And you were the last to present before our coffee break here. So thank you, Rook. Thank you, Marco. And we'll be back at 4:10 Central European time, which is in 15 minutes exactly. So make sure to be back in time, on time. See you soon. Hello, welcome back. It's your last shipment of innovation, excitement, and fun during our final demo of the Spring 2024 Caelestinus batch. And we are going to hear 5 startups, our Caelestini, presenting what they have achieved and doing their asking for money, for helping to grow, and that's what we are here for. It's my pleasure now to welcome Alan. Alan, nice to see you again in your cool office. And
Thank you.
Alan from YCare. I mean, if someone asked me YCare, I don't know. So hopefully, Alan, you explain why we should care. Okay, Alan Gobbs, YCare, the stage is yours.
Yeah, thanks, Thomas. So hi everyone. Fabulous to be here. I'm Alan, the CEO of YCare, and we are building the most comprehensive AI-powered hospital-at-home platform in partnership with InterSystems, Dell Technologies, and NTT. And today we saw incredible innovations, really like great point solutions which measure a lot of things using AI. And the only problem is that most are not adopted by major health systems. And we're trying to solve this issue and really help these point solutions to be used at scale. So our mission is to integrate all available digital health solutions and put them into actual practice. I'm a venture investor with 5 IPOs on NASDAQ and 4 M&As. Joining me today are Vadim, our founder, who has a background with Motorola and Citigroup, and who built his own home healthcare agency in New Jersey and sold it a decade ago. Clara, our chief clinical officer, owns a home healthcare agency now in Florida. These two colleagues know all the ins and outs in home care business from technology and clinical standpoint. And Luis, our chief operating officer, spent 25 years as a partner at McKinsey. Sergio, our VP of sales, has also extensive experience in corporate sales, including Motorola. So now board we have Steve Laser, who is a global CTO of healthcare at Dell Technologies, and Gregorio, who is managing a multi-billion institutional investor. So we are who we are. So in a nutshell, we automate all Medicare reimbursed services. And thanks to InterSystems and Dell Technologies, we have robust EHR integrations and scalable solutions. Since we are targeting 60 million Medicare eligible patients in the US, we also have an international distribution partner, NTT. We are an end-to-end platform. We provide unified dashboards for the administrators of the health systems. We have mobile apps for the patients and care teams. And we've already integrated over 250 devices and point solutions on our platform at the request of Centers for Disease Control in the US. We address critical challenges in healthcare. And one of the critical challenges is obviously that US health systems are financially unstable, almost 50% generating losses last year. And one of the major potential revenue sources could be virtual care, and it grew 40 times during the pandemic. But still, it's only 5% of the allocated budgets. I would like to share how we can use AI to finally scale virtual care. So for providers, we can help health systems drive their population health initiatives. We can help identify Medicare eligible patients who would benefit most from remote patient monitoring, using machine learning, using vector search. And this will bring in new revenue from home operations and prevent avoidable readmissions. For physicians, we are developing this decision support solution, which identifies which devices and digital health solutions are most helpful for each patient. And this raises awareness about the solutions and helps automate prescription of these services. And finally, with respect to care teams, we have burnout crisis in the US. Over 30% of nurses are looking to quit healthcare altogether. So using generative AI, we are building an AI nurse avatar, AI nurse copilot, who will communicate with patients. And this would minimize routine operations and free up time for actual care. Regarding our go-to-market strategy, it is twofold. In the short term, we are already working with multiple home healthcare agencies and are transforming them into health tech businesses to scale their operations. But strategically, we are working with major health systems and payers. And we are very thankful to InterSystems for the invitations to HIMSS and Global Summit conferences, which were extremely productive for us. And I would like to share some of the latest traction which happened during the program. So we signed an MOU with the Indian River State College, thanks to introduction from InterSystems colleagues. This is one of the largest US institutions which prepares nurses for the nationwide market. And we are aiming to build together a vision room for hospital at home solutions where we could showcase all of the solutions which were mentioned today also. We launched a pilot with UF Health to monitor heart failure patients who are waiting for a heart transplant or are not eligible for transplant. And as you know, University of Florida Health is a top 20 health system in the US, and the impact could be really massive. Here on this slide, we also show the pipeline of home healthcare agencies which engaged with us over the last 3 months. So during this incubation program. And from the business perspective, even though we charge health systems only a fraction of what they can get reimbursed from Medicare, this can actually still make a large, sustainable, profitable business for us with immediate over 10 times ROI for health systems. There are hundreds of remote patient monitoring companies in the space, but on our side, we are an integrator of other solutions, not trying to sell our own proprietary devices. So we aim to use the abundance of innovation in the US and bring this to hospitals and patients. And we are specifically differentiated to some of our closest competitors. And these competitors were recently acquired by big tech, retail, medtech, other large corporations. So there's a lot of interest from the industry, from different verticals in this type of solutions. All in all, we have a great team with hands-on experience in building successful home care businesses and numerous multi-billion exits. We act in outstanding strategic partnerships, and we have been serving our customers, our patients for years. And right now we're looking to scale empathy and support to patients on a global scale. And if I have a few more seconds, so I'd like to say big thanks to Caelestinus team and InterSystems team, because the last 4 months were really transformational for YCare. Thank you. Ready to answer questions.
Thank you, Alan, for your fine words and impressive presentation. And we are ready for questions. So, anyone listening, anyone wondering, either here on Slido or on the call, just raise your hand. Or even you don't have to raise your hand, just bump in. Right. So, it's again me who is the most curious person in the room, physical and virtual. But, Alan, this solution of yours sounds like grand and all-encompassing. Is there like a focus how to differentiate in the thousands of other proposals to analyze data and come up with, savings and better use of resources? What's the, is it a patent algorithm, or is there something that is the differentiator in your solution?
Yeah, sure. So again, there are a lot of competitors in the space. Mostly they are like trying to push their own suite of devices into major health systems, which I think unfortunately will not work because you cannot keep up with innovation. So it's much easier to integrate third-party solutions. And then what we bring to the table is solving EHR integrations, all the integration with the payers, all the communication with the actual end customers, patients, and patient engagement. Some of these solutions are surprisingly not patented yet. So we are now patenting some of the side of the patient engagement specifically, and using this AI nurse engagement way. We already tested this using the EHR data and using Iris for Health. It worked very nicely. So all of that creates a way to provide a sales channel into major health systems for 4-point solutions. So there are not too many competitors specifically doing this, integrating other third-party devices and digital health solutions. So so this is the way we differentiate ourselves. Based on the figures which we got, we managed to decrease readmissions by 25% and raise patient engagement from less than 40% to up to 90%. So we know that this technology works, and this creates a platform for the point solutions to be really successful.
Do you have any particular area of focus for remote patient monitoring? Are you into that?
Yeah, so right now we are going through each vertical. With UF Health specifically, we are now working on LVAD patients, which is cardiovascular vertical. And this would be will be obviously, again, as you said, we are on a mission to create the most comprehensive platform, which means there's a lot of elements to it, and not everything will be launched straight away. Right now, we're already in the market. We're providing all these integrations, but the AI strategy was specifically developed during our time at the InterSystems and Caelestinus acceleration program. And we're going now vertical by vertical. We start with the cardiovascular vertical, and it would be huge by itself. We screen all the technologies. We looked obviously at Coredio and many other, which we're presenting today. And we're curating our pipeline for integration so that the health system gets the best solutions available in the market. Unfortunately, health systems by themselves don't have the capability to evaluate thousands of potential devices in the market. And this is where we help. And this is our core competency and core functionality on our end. Just to give an example, UF Health, for example, they specifically looking for devices which are used for those patients who have low blood pressure as normal. And the devices which are available in the market or within this proprietary suites from other players, they are mostly for the standard blood pressure monitoring, and they are not helpful for those with heart failure. So all of that requires a lot of thought and a lot of interaction with the vendors, and we become the one vendor for UF Health, providing all of the support and maintenance of all of these devices.
Right, I have a very specific question related to Validic. How are you different from Validic? If you know, of course.
Yeah, sure, we know that. Yeah, so basically, the funny thing is that this whole area is very much fragmented, and it's felt as if there's a very low barrier for entry. So whoever is developing their solution right now is too late. If they are not in the market, it's too late to get into this market. And secondly, you cannot, just impossible to succeed in this market unless you have partnerships like InterSystems or some other EHR providers maybe. And there are some competitors which do have such partnerships, only few. And then, of course, you need somebody like Dell Technologies, and you need distribution partners. So the way it works, that not the best product would win, but those who are trustful, who have the reliability, history behind, and who are integrating those solutions which are being used within top-tier health systems. And that's not the case, unfortunately, with Validic. But I cannot go into detail. But yes, we are monitoring all of these companies.
Right. There's a last question. Do you have a double-sided market, revenue from vendors and revenue from the EMRs?
Well, yes, this is correct. So we basically, primarily, our business model is based on the fraction of what major health system getting from the Medicare. So we charge them subscription services per patient per month who are using our platform. But then, of course, we charge the point solutions for getting the traction from our B2B customers. That's correct.
Right. So, Alan, thank you very much for your presentation and being with us here. And again, helping to create order out of chaos. That's how I understand your solution. That's always appreciated. And we'll be moving on. So we should have...
Thank you.
Thank you again. And hopefully we have Kathy online.
Yes, I'm here.
Excellent. So NXgenPort, we have Kathy. We can hear you. So far, I think we could see the screen. Yeah, now it's perfect. It looks all set up and we are ready to go.
Excellent. Well, hello, everyone. So happy to be here. It's been quite the journey, and we've gained a lot. So my name's Kathy Skinner. I'm the CEO and co-founder of NXgenPort, and I'm based in St. Paul, Minnesota. Let me start by saying 20 years ago, cancer came to my house. We all know someone who's been touched by cancer, and for me, it was my father. Like my dad, 50% of patients undergoing treatment suffer from low white blood cell counts that lead to an infection and a delay in cancer-fighting treatment. Infections lead to unplanned hospitalizations, costing the U.S. healthcare system $2.3 billion annually. And up to 50% of hospitalizations are avoidable with early intervention. Imagine the impact we could have on a cancer patient's outcomes if we could catch signs of infection before patients have symptoms, plus saving over $1 billion. Current methods of monitoring patients at home between treatments are missing critical health information, and we created a better way. NXgenPort is the first of its kind implanted smart port that detects early signs of infection by measuring changes in blood cell counts, heart function, and vitals. And let me be clear, we've heard many wonderful presentations today about wearable devices, and we think the future is implanted. Every year, 800,000 new cancer patients receive an implanted port, and we've reimagined the existing conventional port and made it smart. But why now? Healthcare is exploding with examples of science and technology breakthroughs, and there are pioneers in remote patient monitoring. Think of continuous glucose monitoring in diabetes, or EKG implantables in cardiology. Oncology is ripe for disruption. And we think, as I said, the future is implanted devices. You've never seen anything like this before, I can guarantee it. Just like these other health disruptors, NXgenPort is not an incremental change, but a major shift in remote care. So let's go deeper into the technology. We designed a micro in vivo cytometer using the conventional port as our template. We add microelectronics with a battery in the body of the port and intravascular cytometry sensors in the catheter. Using multi-angle light scatter, we analyze the blood cells as they flow by the optic probe. And we've been working with a leading expert in flow cytometry named Dr. James Leary. In the center of the screen, you can see light scatter images from conventional flow cytometry. As I said, cells scatter light differently based on their size and complexity. On the right, you can see what we expect an implanted device will be able to capture with the same light scatter principles. And here's the data play. This is important because it shows how we will identify and count cells to see changes in real time over time. So think of this technology together in a platform. Think a combination hardware, software, and data. We analyze the longitudinal findings and share them with physicians through an API like the one that InterSystems has that integrates with their electronic medical record. The healthcare provider contacts the patient before a problem escalates to hospitalization. So going deeper into the software, the raw data flows from the device via Bluetooth to the cloud, where NXgenPort operation analyzes the data. And by partnering with InterSystems, we can leverage an API to connect to electronic medical records and leverage the full stack of FHIR, monitoring, security, compliance, and cloud management. And we measure the data points that oncologists use every day to do two things in the lives of their patients. One is look for early signs of infection, and two, determine if a patient's even ready for their next chemo. Should they hop in their car, drive 2 hours to the hospital? Will they get their chemo that day, or will they be sent home because their blood cell counts are off? So we joined the Caelestinus program because we wanted to expand on the predictive algorithm that we built last year when we participated in the Mayo Clinic Platform Accelerate program. Through that program, we built a model that had 85% testing accuracy, and we knew that we could connect with local hospitals or hospitals within the InterSystems system to get access to greater patient data. And so our premise was to seek pilots in care networks to gain that patient data, to look at validation and digital health, and to build all those elements. And we're the leadership team to bring this product to market. I've spent 15 years working in oncology, and this is my third startup. I focus on investor relations and strategic partnerships. Dr. Roseanne Welcher is a leader in companion diagnostics. She's taken 50 products to the FDA and holds 17 patents. Kelly Christian is our VP of engineering and has spent 30 years bringing new medical devices to market, including new chemotherapy ports. And Dr. Gesme is our board chair. He's the former president of Minnesota Oncology. And the size of the market is significant. As I shared, every year, 800,000 new cancer patients receive an implanted chemo port. And still at that size, ports are underutilized. So based on the size of the market and the opportunity for additional revenue streams, our forecast shows $216 million in revenue 6 years after commercial launch. And we see strong growth in 3 segments over the next 5 to 8 years. Initially, we'll focus on the first 2, selling chemo ports, and remote patient monitoring based on a SaaS model. We're leveraging existing US-based CPT codes and reimbursement models, and we forecast $7 million in year 1 and $19 million in year 2. We hold all of our own intellectual property. We had our first patent issued last year. Our second patent is published, and we have several patents in the pipeline. Our FDA strategy is pursuing breakthrough device designation. In the next 45 days, we'll be submitting our pre-sub to the FDA, a class 2, likely a de novo, again with the breakthrough device designation pathway. To date, we've been highly capital efficient. We've raised over $1 million. We're currently raising our seed round for $2 million. We'll be conducting several animal models in the next 18 months and building out our predictive algorithm. We'll launch our Series A in late 24 or early 25. We have a line of sight to our FDA clearance in 26 and our first sales in 2027. We're bringing this investment opportunity to you where we're raising $2 million on a convertible note with a $6 million cap. We'll be using the funds to continue to build out our product and algorithm development, build out our patents, conduct animal models, and do our pre-submission to the FDA. I'll go ahead and pause here and welcome your questions.
Thank you, Kathy, for your great presentation. Yeah, let's have questions. You can use Slido with Final Demo Day hashtag, or if you can ask questions directly here at eChem. My question is, in a way, very dumb. It's a user question. How does it feel to have that implant? The advantage of wearables is that you can take them off and it's not as invasive, but to me, I would get this, how does that feel? Do I feel do I feel it inside? Is it uncomfortable? How could you maybe explain or describe this to me as a naive patient who might get scared with all these implants?
So the brilliance behind our strategy is we're leveraging an implanted device that's been used for decades. This port has been implanted under the collarbone, the catheter goes through into the heart, and while that sounds scary, physicians have been using that device to be implanted in the body, delivering chemotherapy to patients for decades. And it's very slight, it has a low profile, and patients like it because the veins in their arms get fried from using the toxic drugs or too many pokes from blood draws. And so to have the port is a great sense of comfort and ease. And then what we're doing is taking the existing port and adding additional capabilities to make it remote patient monitoring, to manage patients hospital at home, in between treatments, avoid hospitalizations from infection. So we're leveraging an existing implanted device in a completely novel way. I see Matthew has his hand up.
Okay, Matthew, please.
Hi, Kathy. Thanks for that nice presentation. I think this is a really interesting idea. So just a little bit of color on the regulatory pathway. So you said class 2 de novo. I'm guessing that you're going to point to predicates for the catheter portion itself, right? And then the de novo pieces for the essentially the flow cytometry.
Correct. So the existing chemotherapy port will be our predicate, but other things like glucose monitoring, defibrillators, pacemakers for the batteries, for the technology, the things inside is what we'll leverage as predicates. And we'll be testing basically for safety, but we're not changing the form or footprint or function of a port. So the safety concerns need to be validated, but they're not a big barrier.
That part's clear. So what's pushing you over to the de novo pathway? Is it that flow cytometry piece?
Yes, there's nothing in vivo or in the body that's measuring blood cells in real time over time.
Got it. Okay. And then are you partnering with a manufacturer for the catheter portion of it? Or are you going to create that yourself?
We have several partners, one in Utah, one here in Minnesota, that make catheters. And we also have a port manufacturer out of Boston that's been making ports for Becton Dickinson, but they don't have any exclusive license.
That's great. Okay.
Yes.
And then last question on that Minnesota angel investor tax credit. Is that
Yes.
only for Minnesota residents, or does that go ex Minnesota as well?
So the beautiful thing is if you invest in our company, the state of Minnesota will write you a check for 25% of your investment and send it to you, even internationally. So if I'm in the state, I get a tax credit on my return. If I'm outside the state, they send you a check.
Perfect. That's great news. Thank you so much for that.
Thank you.
Right, we still have time for one or two questions, so you can use Slido, or if you're on the call, just raise your hands, or even without raising your hand, speak up. My question would be related to your market. Is it US only at this stage, or have you also been looking elsewhere, Kathy?
So initially, our business case is focused on the US market, where we see positive operating margins by year 2. And again, as I shared earlier, revenue, $216 million in revenue 6 years after commercial launch. And that's focusing on the US market. And the reason we chose to start there is there's 72 comprehensive cancer centers that treat over 800,000 patients annually. And that's a very specific direction to launch our very focused sales team, and knowing that these hospitals, one hospital spends $105 million per year dealing with infections. And by investing in us at just $17 million for adoption, we can save them almost $60 million annually with the integration of NXgenPort. So we're starting in the US, knowing that we would have a reach with the data points into other parts of the world.
Question from Slido. What cardiovascular metrics can you measure with your implanted device?
So we're initially focusing on getting measures around body temperature, blood pressure, and oxygen level. So we're working with organizations that have some of those sensors off the shelf. And our secret sauce is this micro in vivo cytometry, where we have our patent and our novel technology.
And last question, you mentioned that you believe future is implanted.
Yes.
Why do you believe so?
Because the level of adherence and engagement to get patients to wear their devices, charge their devices, have patches, it puts the burden on the patient when they're already very burdened by managing their disease and trying to survive their disease. So I have a chip in my dog. I'd like to put one in my son, just to keep track of him. So it's the reducing the nuisance of wearable devices and also reducing the errors affiliated with that to get clinically relevant data that's accurate and usable based on existing clinical protocols.
Okay, sounds fun. Pretty clear explanation. And let me thank you for your pitch. Thank you again for being part of Caelestinus, and for all of you watching our demo, don't leave, don't go party yet, because we'll be announcing at the end of this session, of the last lot, our special prize winners. So don't disappear once you present it, because it might be you, the winner of a Caelestinus Special Award. So it's now my pleasure to, whom do we have? We should have Alex from Traverse Health. So hello, we can see you very well. And let's...
Just give me a second, let me pull my slide deck.
Yeah, now we can see your slide deck. Are you into mountaineering? Yeah, traverse. You're traversing Mount.
Very much.
Yeah, Mount Health.
Very
Okay,
much
Traverse Health.
into it.
Go ahead.
Thank you. Thank you very much, everyone. Hello again. Pleasure being in here. It's been quite a journey for us, for everyone, I assume. And I'm happy today to provide some update on Caelestinus program for Traverse Health. So for some of you with whom we might haven't met yet, I'm Alex Lolet, CEO and founder of Traverse Health, calling today from Amsterdam, where our company is headquartered. And let me start with the pitch. Yeah, so a little bit about the problem statement and what is it that we are solving. As many of us know, healthcare industry heavily relies on scientific and medical evidence. And historically, clinical trials have been the gold standard or main tool for evidence generation in healthcare. And there is across the entire drug development and drug development management pipeline. And there is a peculiar focus, peculiar feature, the evidence generation. It's also one of the major cost drivers in pharmaceutical and biotech industry. And as you can see here on this graph, there is a so-called E-rooms law, which is basically showcasing that R&D, research and development productivity in biopharma keeps decreasing. And clinical trials, they represent a significant portion of R&D expenses. Of course, so there is a call or there is a demand for a new approach to evidence generation and to break the E-rooms law. And there is also another call to support the diversity of the data that we are using. So Traverse solved the whole issue by pioneering blue ocean markets, securing access to valuable underrepresented data. By blue ocean markets, we specifically refer to Middle East and North Africa, Latin America, Asia Pacific. These are massive markets with a lot of growth, especially recently, and a strong demand for real-world data. Apart from that, there is it's either very limited in terms of competition, or in some countries, some important countries in those regions, there is no competition at all at this moment. There is valuable local data, unique populations and ways of delivering healthcare resulting in different disease characteristics, treatment outcomes, and care pathways. And of course, real-world data, it helps in navigating these markets. And what we see recently is there is a push and there is a call from FDA, from EMA, for biotechs and pharma to back global drug approvals with data from diverse ethnic and racial groups. But on top of that, local authorities, they are demanding inclusion of local data into any approval for any new novel therapy that they're bringing, that the companies are bringing to the market. So what is it that we exactly do, and how big is this market? So our total available market is estimated at 21 billion. But of course, we see a lot of different figures. Overall, the healthcare data and analytics market is 85 billion. But in here, we have just highlighted or weighted the proportion based on the markets that we are focusing. And there are three main segments in this market. First of all, the market access, marketing and market access. And that is basically understanding patient unmet needs, also evidence generation beyond clinical trials, and these are we're doing through provision of or collecting the data from electronic healthcare records. Primarily, these are retrospective data. Then there is also digital registries, and the most important distinguishing part of digital registry is a possibility to add economical outcomes to the retrospective data, and then we can move into the health economics and outcomes research, and also build a lot of more advanced analytics like predictive models and risk stratification. And then there is a last segment in here, but which is the most important segment. We are targeting this in the upcoming years. It's synthetic control data, or in other words, how we can use the retrospective data from clinical practice. We can use it in clinical trials instead of recruiting patients to control arm. We can use the retrospective data and compare the drug and research, drug and trial with that retrospective data. So a little bit about our traction to date. And I think that there are two most important segments of this. First of all, the data access. We have now, just a month ago, we signed an exclusive data partnership agreement with Acibadem Healthcare Group, where we are going to be their exclusive partner in real-world evidence research for the next 3 years. It's a great achievement for us. We're also very thankful to the hospital and all the people working in there, trusting Traverse with their real-world evidence research. We have also signed the MOU with Al Musa Specialist Hospital in Saudi Arabia, King Hussein Cancer Center and Foundation in Jordan, and with Al Musa we already started the pilot. So this data access, what it helped us to secure revenue generation. We have finalized our first pilot with Pfizer. Now we have, we believe, a very good relationship with Pfizer. 2 more projects confirmed from their site or outside of migraine, where we did the initial research. Now it's in autoimmune indications. We also have a pilot agreement just from last week with Sanofi, and a lot of advanced discussions with specific data requests from Janssen, GSK, Eli Lilly, UCB, all the major leading pharmas. And these are only the ones that we have been able to talk to so far. We also wanted today to highlight specific achievements that from our time at Caelestinus incubation program. And the most important part of it, of course, is integration of Traverse data models with Iris platform. As I mentioned before, the pilot with Al Musa, it is already based entirely on Iris platform, but we're also bringing the Iris platform to Acibadem. So that's a major step for us, most important part, and we're very thankful for this. I think there is a lot of future in this collaboration. And yes, so where we are right now in our journey, in our funding journey, we are raising our first funding round, angel or pre-seed of 0.5 million euro convertible note. Should provide us 1 year of runway. And what's more importantly is how we want to spend this money. It's specifically to strengthen our relationship with Acibadem and Al Musa hospitals, to finalize these pilots in interoperability and data extraction, to build additional data lakes or data registries in core therapeutic areas for Traverse: obesity, diabetes, oncology, breast cancer. That's the most important project of today, autoimmune indications. And of course, we want to reach 0.5 million in revenue with our key customers, you guys mentioned on the previous slide. And with this foundation, we want to secure a proper pre-seed round of 1.5 million euro within the next 12 months. So thank you very much. Thank you.
Thanks, Alex, for your pitch. It's rather an update. I can see that you'll be raising money soon, and you seem to be on track regarding new pilots and new clients. So congratulations to your progress during Caelestinus, and it's been great having you on board. However, now it's question time, so anyone through Slido or here in ICAM, you are all welcome to ask questions. Oh, we have Tomáš here, so please join me on stage again with your blue mic.
Hello. It was nice to see your presentation. One thing which comes to my mind is that I've seen that you focus on the pharmaceutical companies as your typical customer. Do you have any ideas of other segments, other type of customers?
Yes, thank you. Thank you very much for the question. And so for us, the main focus, which we are actually converting already, it's not only the large top biopharma, but the so-called biotechs or biotechnology startup companies. And that is for those companies specifically, we're building this data registries of the clinical grade real world data, as we call it. And that is specifically the data that you can use in clinical trials, supplementing or sometimes even substituting the data, well, mostly supplementing the data in clinical trial. That is one very, very important segment which we're pursuing right now. There are already some early discussions with biotechs. And then again, it's still biotechs and pharma, but we want to go through partners, through clinical research organizations, CROs. So instead of going directly to our customer base and all these biopharmaceutical companies, we actually want to implement a bypass through CROs. These are the segments that we are working on right now extensively already. So that is more or less happening now. The other segment, of course, is insurance industry. We have been having quite a few discussions in the past couple of months with insurance companies, both in the Netherlands, in Spain, and also outside. And it seems very promising, but we believe we need a little bit more expertise, and we need to build up our own knowledge around it a little bit more to start targeting insurance industry.
Thank you. Okay, thank you.
Thank you for the question.
Thank you, Alex. We have no more questions, but perhaps you could sum up how we could help you at this stage, this unique bunch of investors, healthcare startups, enthusiasts, and practitioners.
Well, of course, for us, the main aim today, and so to say, to provide this update is to focus on our angel round, and especially within the program, we have been able to build what we believe a more solid foundation for us to be ready for the angel round. So every investor in the room, you're very, very welcome to join this round. We are, especially if it's coming from Caelestinus community, that will be a very, very good sign to us. And that is first of all, and also right now, I think through this journey of the past couple of months, it's more of it's not that much of a pure venture capital anymore, so to say. It's more like investing in a company with a proved revenue, proved pipeline. So that would be one thing. So investors super welcome, and we hope we can engage into some discussions around that. And then for the companies, for us, the other very, very important part of Caelestinus program was studying more and understanding much better the wearable device part. We see a lot of, let's say, raising demand for wearable data, and that is the data that we will be integrating into our offering. So all the companies here that are developing wearable device, we look forward to continue to stay in touch, first of all, and continue collaborations. And hopefully within this year already, we can set on a pilot together to combine the data that we have from EHR, but also to enrich it with wearable data. Thank you. Thank you very much.
Thank you, Alex. Wishing you best of luck. Hopefully bumping into you soon somewhere. Thanks, and we are moving. We have two more to go, and it's my pleasure to welcome tina.care here on stage at ICHEM. So I think you can. We all fit in, but I'll leave you alone in a few seconds. So are you ready? Do you need anything like clicker or clicker? Yeah. Okay, so it's tina.care here at ICAM.
Please unmute your microphone.
Okay. But we are only a small part of the whole team, tina.care. Primarily, tina.care is name of our product. Which is made by Czech company with the name Bonitu. At the beginning of the whole tina.care story are our personal experiences, as by many cases of you. We connected also our situation with situation of the market. Simply, we could see that there is a lack of caregivers, but a high number of seniors, and that in general the population is aging. The caregivers are very often overloaded, and just imagine that one nurse has the responsibility for the whole department within the night shift. So he is responsible for approximately 30 patients for the beds. So we tried develop system which will make the work a little bit easier for the staff. Also brings more safety or additional safety for the patients, and also will bring peace in mind of families and relatives of the patients. And what is tina.care system? This is a whole system, camera-free and monitoring system for patients. It consists from two main parts: sensor above bed and mobile application. So the mobile application in mobile phone, on TV screen or in tablet enables to the caregivers see the situation on the whole department at a glance. So it's a supporting tool for the caregivers. Behind this whole system is strong team of our experts and deeply experienced developers. Here you can see the main core of the team, but there are more people behind this thing. Regarding business model, the sale consists of two main parts. From the price from the bed sensor for the device itself, and regularly monthly service fee for the operation of this sensor. Our main customers, what we are focused on, are hospitals or various facility centers and social facilities and treatment center. As I mentioned at the beginning, that there were personal reasons for development of this device. So we can see very potential and also big interest in B2C market, but at this moment we are oriented only for B2B. The breakpoint we see at the point, or we have calculated for the amount of 2,000 pieces sold sensors. We are focused at this moment for the Czech market. We don't make the sale directly. We cooperate with our partner, Czech partner. and we think that we will good manage the situation at the Czech market. We have already one paying customer. With 2 more, we are in a close negotiation. And on a Thursday, thanks to our participation in Caelestinus, we were also in Hradec Králové. So, yeah. As I said, tina.care is product developed by Bonitu. It's also financed only by Bonitu. We are now in the stage of product MVP. We can see much more possibilities in this solution. So we have a lot of further step before us. So if this whole sounds great for some investors, we will be very happy if somebody would like contact us. And that's it.
Thank you. Tina.care for your nice pitch and presentation. And I guess it's question time. So all the questions you might have, send them to us via slido.com or ask them here directly. Or if you are on the call, you can just shout. Okay, so here comes this question. So what do prospective clients or customers usually ask you about when you present?
At the first moment, are some of them resistant because this is a new technology, but after some time they find this solution great. They need some time to get used for this new system. They need to know how to work with the application, and then they can have some calm time for their rest and use these functionalities.
Yeah. Which technology do you use?
Well, the sensor is detecting a movement of the patient. It's very, very sensitive one, which means that it can also measure breath rate and heart rate, but we are not publishing these values officially. We are using this just for better identification that somebody is on the bed. And well, maybe later on, it is also connected with medical device that we have to manage or finish the certification, and then we can show some more detailed information that we can get about the patient.
So I suppose it's a sensor that you built. That's the know-how.
Yes, I would say the sensor itself is not that complicated to build. It's more about the algorithms around, because we have to process the data, as well as what was a big surprise for us when we developed the solution and started the pilots, that I would say the process inside the hospital is much more complex than just detect that somebody left the bed or have some issues. Yeah. So there are hundreds and hundreds small things implemented into the product that are really helping and build a very useful solution.
Do you need a certification for your product, for being able to use it?
Well, it's a technical device, so we need a lot of certifications because it's an electrical device, as well as even when we are not managing, I would say, personal data, we don't know who is on the bed, which is monitored. Still, we have some medical data that we have to manage, which means, yeah, a lot of certification that we had to finish.
So what is the thing or that you are mostly looking for at this moment? Is it pilot organizations, hospitals willing to implement, or is it more like investment money?
We would like to scale up because currently we see that we can manage the Czech market. without any issue. We see that the solution works pretty well. And yeah, we would like to grow. Even in the Czech Republic, of course, we can be profitable, but this is a solution that can help worldwide.
So you mentioned that so far you have been financing the project yourself from profit of Boni2.
Yes.
Is it something that you'd like to do in the future, or would you consider external financing to scale and grow?
I would say for the Czech market, we can manage it ourselves. But if we want to grow outside the Czech Republic, we definitely need help from outside.
Okay, fine. Any other questions here from the audience? Well, you have this unique opportunity to ask yourself a question. Use it. You still have a couple of minutes.
I think there is nothing what we don't know about the whole system because we are permanent in touch.
Is it actually dependent on any particular bed manufacturer, or can it be used with any sort of medical bed?
It's a very independent solution and device. It can be placed above any type of bed, so it's just need to be connected to electricity, and this is also the advance of this solution, that it's possible to move with the beds without any disconnection.
Yeah, but bed swapping was one of the key requirements from hospitals, because they have to move the beds very often, and it has to be somehow disconnected from the bed.
And I can see we have a question finally from the audience.
Yeah, I should first declare that I now partly work for tina.care, for Boni2. One question, what does the nurses like with your solution?
Yeah, I would say the biggest value that I hear very often is if they have night shift, yeah, and there is one nurse or very, very limited amount of people that are responsible for the whole department. They are able to manage it very easily, because they have the whole overview of the whole department on one screen, and they can manage it, and they can do some other things and activities they are responsible for.
And I would add one more comment of families of the patient, which asked what is it about the bed, and when they heard what is it, they were more satisfied and more peaceful.
Wow, so it's great to hear and see that these things are happening in the Czech Republic, and hopefully will help you spread them to other continents and other countries. And I'm happy that we have had the chance to have you among our Caelestini. So thank you very much, tina.care. A big applause.
Bye-bye.
Thank you.
For tina.care. Thank you. Right, so you just deposit your mics exactly there, and we have our last Caelestinus to present today. So yes, that's Embryoxite, and we have Delfina online. We can see you.
Yeah.
And hear you perfectly.
Hello. Okay, great. I will share my screen. If you, I will share. It's okay.
So far, yeah, it's there. We can see your screen.
Okay, great. So since the beginning of humanity, each of us has been conceived within the maternal womb. Today, the number of births assisted by in vitro fertilization has reached more than 12 million worldwide, and it is not only used to address infertility issues. IVF is having a huge impact on our society, providing families or individuals with the autonomy to shape their journey towards parenthood. In this context, and despite technological advances in assisted reproduction, the ability to meet the growing demand has not met the expectations of those who undergo this invasive treatment. With 186 million people facing fertility issues and 85% without access to it due to a high cost, the situation is challenging. Even more worrying is that the global success rate for IVF treatment is just 30%. For some couples, starting a family takes a few months of trying. However, for others, the journey takes longer, facing a deep psychological and emotional challenge. Hi, everyone. My name is Delfina Villeri. I'm the founder and CEO of Embryoxite. Let me draw the critical points in the actual patient journey. It starts with a few initial medical interview for traditional fertility diagnosis. Then the eggs are fertilized outside the maternal uterus, and the resulting embryos are stored in incubators for 5 days. During these days, the embryos are closely monitored to assess their development and quality. One is then selected and transferred to the mother's uterus. This process is highly dependent on embryologist expertise. That's why the 70% of the IVF cycles do not result in a pregnancy. So what if we could do something to improve this patient journey? At Embryoxite, we understand the challenges of IVF treatment, so we have developed a pre-implantation test that helps to identify what is the embryo with highest pregnancy potential. It is a non-invasive technique that allows us to predict implantation success with up to 76% accuracy. Alongside the pre-implantation test, we have developed our embryo system that was designed by experienced embryologists. We offer deep learning models for clinical data, embryo images, and metabolomic data. So now, the initial medical interview will be recorded on our embryo system as part of the new patient journey. Once the treatment is underway and the eggs has been fertilized, the embryologist will take a sample of the culture medium where the embryo develops and send it to our laboratories, where our scientific team will analyze this sample and upload information to our embryo system. We're going to offer IVF centers and the professionals a prediction implantation score, so they could make a precise decision based on data of which embryo should transfer to a mother's uterus. Our main goal is to increase from 30 to 75% the pregnancy success rate. Our embryo system allows for a personalized IVF treatment that will not only make assisted reproduction technology more effective, reducing time to pregnancy and improving quality of life of patients, but it will also make it more cost-effective. We have signed 14 commercial agreements, and we are working with 16 IVF centers from Latin America, Europe, and our next goal is landing to the United States. On the one hand, we plan to monetize the insights generated from the embryo system by licensing anonymized data to third parties such as pharma companies, and on the other hand, a subscription model for IVF centers of our embryo system. We are positioning in the market as a provider of innovative solutions combining two fundamental areas. On the one hand, molecular diagnostic, and on the other hand, artificial intelligence. The 40% of our team is made up of embryologists with more than 20 years of experience working in IVF centers, and the 60% remaining are engineers focused on technology, information, and business strategy. This year, we face great challenges such as finalizing our patenting process, commercializing our embryo system, raising our next round of investment, and landing to the United States. We're committed to increasing the chances of a healthy pregnancy for those hoping for a baby. You are invited, everyone, to join our mission. Thank you so much.
Thanks, Delfina, for helping our children populate the world. So, questions? Okay, here we go. How do doctors currently select embryos without AI? What are the common indicators of a good embryo?
Okay, the embryologist is the professional who decides which embryo should transfer to a mother's uterus, and it's based principally on expertise of years of study, and they see through the microscope the morphological aspects and depends on the diameter, how many cells are outside the embryo. They decide which embryo should transfer or cryopreserve. Principal is embryologist expertise based on morphological aspects.
Right. So maybe you could again highlight how AI changes this game. Is it no longer just the experience of the embryologist who checks the samples? Is it like an aid, a helper, or does it do the job on his or her behalf?
No, that is the typical fear of an embryologist, that AI will take their employee, but we try to explain them that embryologists using AI will take their jobs, their current jobs. We believe that it is a tool, so they could make a precise decision of which embryo should transfer based on data. And we believe that the market is going through a personalized diagnosis based on different layers of information, such as clinical data. For example, it is really very important the age of the person who is making the IVF treatment, but we are also analyzing embryo growth imaging or metabolomic data. This is the core of our startup, because we are a biotech startup. But we don't believe that we are not going to need in the future an embryologist, if not that this data and the models we are developing will help them to make a good decision, and we try to improve the pregnancy success rate.
Okay, thank you. We have one question from Tomáš here at ICAM.
Hello. I've seen that you have now partners also in Europe. One thing is that, for example, Czech Republic is known that it has very liberal laws and regulation. My question is your product somehow regulated in terms of laws and or in terms of some other aspects?
Yeah, well, we're working with medical data, but we are not developing a diagnostic, if not a scored implantation success rate. So it depends on EMA, FDA, or the organization that will define if we need a certification. For example, we are working in the United States, and at this moment we do not need FDI approval. So we are working with each country or region to analyze if we need a certification, because we are developing algorithms, not a diagnostic.
Okay, and the follow-up question is that in some countries they are regulated that if you choose and if you do test on the embryos, for example, genetic tests, they, for example, regulate doesn't allow to further proceed, and it is, I think, very liberal here in Czech Republic. I don't know if it also affects you, this kind of regulation.
Yeah, as we are developing a pre-implantation test, we have to go through some certifications, but as I mentioned, it depends. There is not a general rule, but I want to mention that we have partners in Europe, in Spain and Italy.
Okay, thank you.
Thank you, Tomáš, for questions. Checking my Slido. There are no further questions, but perhaps, again, Delfina, you could summarize again why and how we could help you at this stage, either from investment point of view or forging new partnerships, new hospitals, new countries. What is your priority at this stage?
Well, first, I would like to start thanking Caelestinus InterSystem for this opportunity. We believe that the program helped us a lot because we connect with many people that are working with similar things. So it was a great opportunity to learn about their opportunities. And in this moment, our main goal is to raise our next round of investment. We are looking for $500,000 to finalize our patenting process and commercialize and to start our pilot by the end of this year. So everyone who, every investor that they are participating or just is connected, you are invited to join Embryoxite and our mission. And I will be very happy to send our deck.
Thank you, Delfina, for your presentation and also for being the last Caelestinus to talk today at the Spring 2024 Caelestinus final demo. So thank you so much. It's been great. I have to admit that it's quite something to sit through 15 well-crafted and extremely interesting, exciting presentations. I hope you are still conscious and have been able to take in all the messaging, all the great offers to invest, to participate, to help. What is going to happen now? I should have some slides whereby we will be announcing the special awards. Caelestinus Special Awards. So let me check whether I have the slides. Of course, this is just a recap. This is what we have just heard since 2 until almost 6:30. So that was 3.5 hours of intensive pitching by our Caelestini. You were amazing. I'm still impressed how the quality and your dedication goes up and up every year. So this just makes me wonder, where's the limit? Is sky's the limit? I'm not sure. Great job. For those that can make it, I mean, still, if you get a chartered private jet, you can fly in to Prague for our after party that will be starting in 1.5 hours in Swim Club, which is an old former swimming pool. Now it's the greatest party place in the center of Prague. So we'll be there starting 8 p.m. and hopefully we will stay as long as we can. Well, I think we had Dean. We will be hearing Yevgeny, but before I ask Yevgeny to tune in and say final hello and maybe do a recap, we should be okay. I'm not sure where I am. Sorry, the presentation is. It's from the beginning, so I need probably to click through and see. Yeah. Let's go. Okay, here we go. Where is it? Okay, so we will be now announcing awards for our best performing startups during incubation. So it's the awards that. Yeah, it was good. I had the right slides. Come on, guys, leave those here. Don't take away from me my slides. I love slides. You know, they. Have you ever dreamt of slides during your sleep? It actually happened. You know, this is how deep the slides go. So, do we have the right slides? Yeah, excellent. Thank you. So let's have them. I don't see them on screen. Okay, they are here. Okay, why not? Awards. So the best performing startups. This is what you get. We don't provide you with additional investment or money. We will give you a digital badge and certificate. You get some additional learning opportunities by InterSystems. And, this extra badge will give you some extra spice. But of course, all of you that pitched today, the 15 startups, you are winners. My utmost respect. But still, we like to keep it spicy and distribute prizes. And you love receiving prizes. Yeah, we have seen in your pitches, I got this prize, I went through this. So why not show it off with your special achievement digital badge? Well, so the first prize is the biggest number of pilots award. So let's see, I have some background info to see who gets this special prize. Right, so I'll tell you something about who gets this prize without revealing the name for a while. So we have a company, a startup with 11 committed pilots plus 4 pending. So since the program started, new doors are opened in the upcoming weeks, and the startup helped to exchange contacts in the community, raising 1.4 million. Well, who that is? This is it's Heuristik. So a big clap. Heuristik. Anton, are you there or have you left to celebrate on the beach?
Yeah, no. It's raining in Bilbao, so...
So, Anton, my congratulations from all the Caelestinus crew. You made it. You utterly deserve the Number of Pilots Award. Tell us very briefly, what's your secret formula, your recipe for pilot?
Yeah. Not crossing the line of being a stalker with hospitals, but to be there,
Okay, so Anton, big congratulations. Waving back to Bilbao. Enjoy the show, enjoy the evening. Thanks for being.
Do I get a bottle of Bekerovka?
Yeah, when you come to Prague, I'll have one ready for you. I'll keep it on ice for you. Okay, Anton. Again, thank you. Heuristik, the biggest number of pilots. Right. Now, the Community Choice Award. It's something where you decided, you participated, you voted, all of Caelestini that have been part of our incubation program had a chance to vote, like who should get this special community award. Okay, enjoy the few seconds of suspense, and I'm going to reveal who that is. Suspense, suspense, suspense. Kathy Skinner from NXgenPort gets the Community Award as voted by Caelestini. So congratulations, Kathy. How do you feel? What's your secret recipe for being the choice of our community of distinguished startuppers?
I think the past where I was formerly a college volleyball coach tends to push me in the direction of looking for opportunities to support others to do their best.
Well, you totally deserve it. It's been a pleasure having you in the program, and I hope that when I finally get your catheter into my heart, it will just feel great.
Well, let's make sure you don't get cancer. Let's do that first. But if you need
I stand pretty good chance. So when I get it, I want your stuff in my heart. So thank you again, Kathy. Big congratulations, and yeah, enjoy the party afterwards. Thank you.
Thank you, everyone.
So, and finally, we have the biggest progress award. I'll give you some reading before we announce it, so that you get a chance to guess who that might be. And it's a startup, a Caelestinus, that was nominated for most innovative use of artificial intelligence at the InterSystems Global Summit a few weeks back. It signed letter of intent with a medical equipment manufacturer. It got the Innovate UK award, InterSystems grant, first pay customer in Georgia, etc., etc. And no doubt you can guess who that is, because it's Praxium AI. So Praxium, big congratulations. Big clap to you.
Really humbled.
Yeah, so how does it feel to be the biggest business progress award? It's like it's BBP, the BBP prize. What's your secret? How do you manage to make such progress?
Unfortunately, we don't have Nelson on the call. He is the business mind of our team, and I think we should attribute most of the applause to him, because he did amazing job both on InterSystems Summit, and overall he is just everywhere talking to all the business guys. Not only them, of course. Well, I'm handling technical side, so. Let's give an applause to Nelson, really.
Yeah, big applause. Probably he's doing business again. You know, left the call and joined another one. That's the way it is. So biggest business progress goes to Praxium AI. My congratulations. Sending regards to Nelson, and I'm sure now he is applying his double Nelson on your future clients. Excellent. So congrats and have fun, guys. Awesome. Right, and we finally move on to our last prize. It's called the Expert Choice Award. And I'll tell you a little secret, because I also voted. It means I'm now an expert, because that's Expert Choice Award. But no, calm down. The rest of the people were real experts. We had all the people from Caelestinus, InterSystems behind the program voting. And I'll tell you something about who that expert choice is. So it's a startup that offered help to others in multiple areas and were very active throughout the incubation, shared great feedback on multiple aspects of team's progress, 3 pilots as of today, 1 with the integration of Iris, 30 clients in total. I think it might be 27, 3 in their pipeline, and the revenue approaching USD 1 million. So who could that be? Yes, you guessed, it's suspense. ROOK. Hello, Marco.
Hey,
nice to see you again.
Thanks.
Just when you were about to leave for the beach or whatever you do in Miami, then suddenly, oh, come back. So, Marco, what's the secret to being impressive for experts?
I don't know. I think it's the team. It's all around. I'm the experts one is the whole team. The Jonas, Danielle, Pepe, everyone. It's like the best ones. I'm so lucky that I have this team, and that's why we are doing so good right now. And of course, our investors and everyone who is believing in us. So yeah, thank you very much.
Amazing, Marco.
Very excited.
Great to have you among our graduates, among our Caelestini. Now enjoy your beach life, and you are the expert choice. Remember, you can always use it at the, in a pub. I'm the expert's choice. So have great fun. Thanks, ROOK, for being with us, and let's bump into each other somewhere, sometime soon. So thank you, guys. This is the last prize that we have just given away in your direction, and it's now my pleasure to invite Yevgeny. Yes, Yevgeny, you're still awake. That's amazing. That's almost 4 hours of pitching, and you look awesome. So Yevgeny Shvarov, the startup guy from InterSystems. So all of you have met him online, offline, and I always recall that we were standing here at ICAM when we came up with the idea to set up incubator program Caelestinus to help you grow and succeed faster. So, Yevgeny, hi.
Hi, everyone. Hi, Tomasz. Can you hear me?
Yes, perfectly.
Yeah, amazing. Yeah, it's only 4 hours, right? So I think we could stay even 4 more, at least. And also, it's a pleasure, actually, to drop in during such an exciting moment of all these celebrations, and maybe Tomasz and team, maybe we need a red carpet for next time, with some Oscar-like things, like something physical. I don't know, but this is great. It's just really great to be part of it, to know you all, guys. Caelestinus 3, the batch 3 of 2024. It's amazing to be in touch with you, to take part a little bit in your innovation, and I just hope that our Caelestinus team made at least little difference in your great path to innovation and to success, to making this planet a better place, hopefully. Anyway, so we Caelestinus team and InterSystems, all the partners, ICAM, everyone, we don't want to say goodbye to you. So what I'm saying that you are all invited to Caelestinus Alumni Club, right? So we will follow up later and with the invitations, and so I hope we will be in touch, and we will congratulate each other with the successes we will face on the go. And also something maybe also important is that before you start such celebrations and join the swimming party, I want to tell you that InterSystems is very happy that you leverage our technologies that possibly will play some role in your success, and we want you to keep using InterSystems cloud resources until the end of November this year. So if you've I hope you'll remember where you can find it. It's available for you in Caelestinus site. Yeah, so we will be just glad that if InterSystems technology will help you. Yes, and with all that, congratulations with accomplishing Caelestinus 2024. And I wish you great success. Yes, you have all these roadmaps, but have success this year also. Yes, so let's, and if our team can help you in this anyhow, we will be happy. And let's start the party then.
Thank you, Yevgeny. Also, I'd like to draw your attention to our new podcast that we are now trying to launch, and so you might get invited to be our guest because it's unique. How to build a health tech startup, global one, and you can already find the first episode on Caelestinus.tech website. And soon it will appear on Apple Podcasts, Spotify, etc. So that, you know, if you get really bored or tired after the party, there is not a better thing than listening to Caelestinus podcast. I think that's right, Yevgeny. What would you say?
Yeah. So, and I'm quite sure that some of you will be the heroes of this podcast, and yeah, it's a great pleasure actually to share the secrets of digital health successes with everyone. And also, it's a great honor that we could invite you guys to share these secrets. So, yes.
Okay, so I'm afraid that's it for the final demo of Spring 2024 Caelestinus batch. Thank you again for being with us almost 4 hours online. That reminds me of COVID. So amazing that you can do it again. Your presentations were impressive. We'll be sending also the Notion side with details, your pitch decks to investors. We are happy to share any contacts we have in Caelestinus with you. And hopefully this year or in a year, you will achieve something you hoped for in 3 years. So that's it. Thanks, InterSystems. Thanks to all the people behind the incubator, especially Petr Žabka, who is, if you were here in ICAM, he's behind in this aquarium where all the guys who helped us with the broadcast are. Thanks to you guys, because you never seen, but whenever there is an issue, like I go, oh, what's going on? So these guys really amazing job, 4 hours, making sure the broadcast, the streaming was spotless. So thanks to you, thanks to Petr for managing Caelestinus, thanks to all the girls behind it, and hopefully I'll see you soon, either in Prague, around the world. Thank you, those of you that made it again in ICAM. Amazing, and I'm looking forward to our party that starts in 1 hour, 18 minutes. So have a great day. Thanks, and I think we made history again.
Yeah, and thank you Tomasz too, and also Vita and Irina for doing this Caelestinus 2024.
Exactly. So Vita, thank you. Irina, thank you. Without you, there would no be Caelestinus, and I'm happy we can work together as a team, virtually, locally, in Prague, in the US. Amazing. Thank you. So long live Caelestinus 2025. Have fun, guys.